Those that might have tuned in to join us at 9 o'clock. On behalf of the Okaloosa County School Board, the school district, and everybody involved in putting these meetings together, I truly apologize that we're starting late. We had a lot of technical difficulties trying to put this meeting together so we could do it through the technology pieces that we have. Unfortunately, as much as we practiced this yesterday, because everybody was working yesterday, it's not working today. So with that being said, I do want to just make an announcement that we do have school board members that are joining us via the telephone, and we do have school board members and the superintendent that are here today. So with that being said, the Honorable Dr. Diane Kelly, the Honorable Dewey Destin, myself, and the Honorable Mr. Chambers are here present in person, and on the telephone we have the Honorable Dr. Lamar White and the Honorable Miss Linda Van Check. So with all that being said, we'll go down to item 2.1, changes to the agenda and approval of agenda. And we do have changes to the agenda, and that would be discussion agenda added item 10.1, revised Okaloosa County School District 2020-2021 school calendar. We have no recognitions at this time, and we are at the visitors part of the meeting. And for those that genuinely or that always tune into our meetings and know that we do have visitors that we typically have at Monday night's meeting, today's visitor is only going to be for workshop only, and it is Dr. Karen Chapman, Director, Department of Health in Okaloosa County. But before we get started, I would just like to make a comment saying that we are very honored to have Dr. Chapman here today. I know I had a great conversation the other day talking to her about coming to the meeting. I was explaining some of the changes I was going to do to give her all the time in the world, but because of the technical difficulties, I'm not going to have to do that. And I believe Mr. Chambers would like to make a statement real quick before Dr. Chapman gets started.
Absolutely. First of all, I'd also like to say very glad that Dr. Chapman is here with us this morning. And, the word unprecedented has been used with this COVID situation that we are in, not only in Okaloosa County, but throughout the country. And Dr. Chapman, I think we started our communication all the way back on February 25th. So you think about where we are today. And I just want to thank Dr. Chapman because she's been a great partner with our school district and helping us along the way. So I just want to reiterate that, Dr. Chapman, and very much appreciate it, and go ahead and take over.
All right, well, thank you very much for the opportunity to present and talk with you today. I do want to reiterate that actually, you all can hear me, okay?
Yes, ma'am.
Is that okay? What Mr. Chambers just said, we started meeting in late February to start getting word out to the parents about what was going on. I want to really reiterate to everybody that we are dealing with a novel virus. And I tended to forget that my husband said to me early on in this situation, he goes, "What the heck is novel? Why do you say that word? Why do you use it?" And those of us in this field are used to that. But this is a virus that prior to about November, December of 2019 was unknown to mankind. We have no natural immunity to this virus, no history with this virus at all. So we were in uncharted and historic territory. Globally and nationally and in the state and locally, we have been planning for a pandemic for years and years. Most of our mindset had been around influenza. This time it was a respiratory pathogen like influenza, but it was coronavirus, and that is a very different animal than influenza. So know that we are in this historic time. Nobody has all the right answers. And we are walking this journey together. And so I will say that we have been on, Mr. Chambers and I have been on the phone since the end of February on multiple occasions. And we have been working closely together. So with that, I'd like to kind of go on with some information that I think is important for you to have as you wrestle with how to proceed with educating our children. I also want to reiterate to you that I think educating children and going to school has always been one of the things that normalizes our community after disasters. After hurricanes, the best thing we can do is get everybody back into some sort of normal life. And boy, doesn't having kids in school really create a sense of normalcy and a sense of calm in a community. And so, you know, I really, this is a big decision of how you're going to do this in this most historic time and keep our children safe. This is a virus, I said, that we know very little about. We're learning every single day. We learn every single week. And people have criticized the medical community and the scientific community because with evolving knowledge, so does come evolving guidelines. And some guidelines have changed over time. But that is what we do in science. We test, we look at, we evaluate, we study, and we make best recommendations on what we know at the time. And as information evolves, new information is developed, we make changes. And I would say that is the basis of science and medicine. If we didn't evolve or change our minds about things, we wouldn't have the longevity we have today because of all the things we have discovered. I also want to sort of point out that there's been some sort of impression that this virus is really no more harmful than influenza. And I don't know how anyone can say that right now. Again, we are learning about this virus on an ongoing basis. And we know that in people who die, we are seeing impacts on the body in autopsy that are unknown to us from prior viruses, with microclotting throughout multiple organs, which is a very unusual finding. Also, in places where they've had longer experience with the virus, survivors, particularly survivors who had severe illness, seem to continue to have ongoing health problems. Some of them are breathing difficulties, ongoing fatigue, reduced muscle function, mental health problems. There's problems with post-traumatic stress disorder and just depression. And so for us to say that we know definitively there's no long-term effects from this virus on those who survive it, it's way too early to say that. So I told Mr. Chambers this story, this fact, the story, a couple of days ago, just to reiterate to you how much we don't know. When measles had been around with us and is a highly infectious disease for many decades, centuries, and at the time we got the measles vaccine in the early 60s, and we achieved herd immunity by vaccinating a good 90+% of all children, something else happened. And that was all-cause mortality from other infectious diseases declined in children. There was no reason for other infectious diseases mortality to decline in children. The only change had been the measles vaccine, but that vaccine was targeted to just the measles. We didn't know why children stopped dying at rates that we had previously seen before the measles vaccine. But it took 50 years. It took 50 years for us to figure that out. It took another virus, HIV, to advance the science. And then it took people not believing in vaccines anymore and stopping vaccinating their children. And then we had a natural experiment in the community and have had the resumption of measles outbreaks. And what have we learned from those measles outbreaks of the 21st century? What we have learned is the natural measles infection wipes out a critical component of the immune system that helps fight infections. And so there we were able to explain that decreased immune capacity caused by the measles, natural measles infection, was contributing to the death of children from other infectious diseases, because in fact, the measles infection had done significant damage to the immune system. It took us 50 years to figure that out. We don't know the long-term consequences of this virus. It is new, it is novel. We are walking in uncharted territory, and it is a difficult journey for all of us. So, where are we in Okaloosa County? We broke 2,000 cases this month, this week, 2,135 as of today. We've gone from an average daily caseload of about 5 per day to upwards of 80 new cases per day. This is not just a consequence of more testing. It's a consequence of more virus circulating in the community. And why do I feel comfortable saying that? Although there are those who don't believe in some of the data I present, looking at the rolling percent positive of all tests done is an important way to make a distinction between more people with the disease because of testing or more people with the disease because there's more disease in the community. And that rolling positivity rate has gone from just around 3% on June 7th to 12.3% today. And 10% is the line that has been drawn where it says really that virus is out of control in the community. So growing number of cases, continuing a rapid rise in our positivity rate is a cause for concern for us in our population and in our community. Our infection rate, this is like a reproduction rate. How many new cases come from one case? You want it to be less than one, because that means people aren't transmitting it to each other. It's a dead end. They are isolated, they are not exposing other people. You want it to be less than one. We have written around 2 and upwards of 3 for new cases as a result of one case. That basically is telling us that COVID-19 is growing at an unsustainable rate in Okaloosa County. We've been monitoring flu-like symptoms, and we are seeing something in the emergency rooms that we follow the percent of total emergency room visits that are attributed to influenza-like illness. Influenza-like illness is a presentation of fever and cough or sore throat, some of the common symptoms associated with COVID. And what's been of interest to us is the significant rise in the percent of visits due to influenza-like illness in our emergency rooms in the past couple of weeks. Generally, we ride below 2% of visits in the community, and you may say, well, how do you know that, Dr. Chapman? That's because we follow it every week of every year for the past 15 years. And we are at levels of a moderate flu season, which we never see at this time of the year. Our hospital beds. This week, we did see a drop in the percentage of occupied hospital beds. Why was that? That's because our hospitals had to discontinue elective surgeries. And so, yes, the number of people admitted for elective surgeries has declined and has reduced some of the burden on particularly the medical surgical beds. Both Twin Cities and Fort Walton Beach Medical Center, as a result of the pandemic and the growing number of COVID cases in the hospital, has had to discontinue all outpatient and inpatient elective surgery as of the end of last week. North Okaloosa Medical Center has discontinued all inpatient elective surgery. So this is their way to manage the insurge of persons with COVID-19 and the need for beds for this infection. Of grave concern is that our ICU beds are heavily occupied. We have ridden in the high 80s or 90s for the past 7 days. In fact, in the past 2 days, there's been one ICU bed available in our community. All others have been occupied. At this point in time, we still have about 43 people in the hospital with COVID-19. And in general, they are occupying approximately 35% of all ICU beds. So, I'll move on to our long-term care facilities. Our congregate living scenarios, long-term care, nursing homes and assisted living, jails, correctional institutions, group homes, all sorts of fall into this category. We have 10 long-term care facilities who are designated in an outbreak status. That's 45% of all of our long-term care facilities. We have one long-term care facility with a very large number of COVID positive residents. And today we were just notified of some new ones. So the number continues to grow. I want to tell you that the people who work in those facilities are members of our community and so are exposed in their day-to-day life to the virus that is circulating. Children have been relatively spared so far. They've also pretty much were out of school pretty quickly after this pandemic started. I thought it was quite interesting that we've had 103 children, 5 to 17, with COVID-19 in Okaloosa County. 66% of them, or 68, have been diagnosed since July 1st. Similarly, with young children under 5, 60% of the 25 have been diagnosed since July 1st. So this is an evolving change. We weren't seeing as many children, and we still don't have huge numbers of children, but it is, again, a new virus. Not sure where we're going with this. Our deaths last week increased by 50%. We went from 10 to 5 deaths. Death is ranged from age 26 to 88 years. We continue to see the majority of our deaths in those who are the oldest, generally above 75 years of age. The virus continues to spread in Okaloosa County. This is the data we use to monitor it. This is a function of there not being stringent adherence to physical distancing 6 feet or more when you are in public places and around people that are not a part of your household, and because of the failure of most of the population to wear cloth face coverings. Now, if you listened to the most recent Board of County Commission meeting, there was a lot of people who said there's just no evidence that these work. Well, we don't have a lot of experience with cloth face coverings in this country. In Southeast Asia and Asia, they do. And in those countries, they have this virus much more under control than we do. But there is a growing body of evidence that cloth face coverings do work for this virus. The WHO and the CDC have now concurred that all people should wear cloth face coverings when around people who don't live in their household, especially when social distancing can't be maintained. So how do these masks work? They work for source control. That means they serve as a barrier to help prevent respiratory droplets from the mouth and nose traveling into the air and onto other people when the person who's wearing the cloth face mask coughs, sneezes, talks, or raises their voice. This recommendation is based on our knowledge, our current knowledge of the role of respiratory droplets in the spread of the virus that causes COVID-19. This is all paired with emerging evidence from both clinical and laboratory studies that shows that the cloth face coverings reduce the spray of droplets when worn over the nose and mouth. And because this virus spreads with close contact, the use of these cloth face coverings is important where people are close to each other and physical distancing is difficult. Recently, I sent information out about a study that was done by the CDC and published in their Morbidity and Mortality Weekly Report that showed the effect of ordinances and company policies requiring the use of face masks by customers and employees in a hair salon. And there was definitive evidence that when not wearing the face mask, the employees did transmit to each other. But while wearing the face mask and while being infectious, the employees did not transmit, I believe it was 139 clients. Interestingly enough, we had that same experience here in Okaloosa County. We had 2 salon workers. One came in with the infection. They ate lunch and took breaks together without a face mask in a rear room of the salon. But because their salon had a policy that they wear face masks and that customers wear face masks, neither staff member of that salon transmitted to the 29 people they exposed. And one person was actually working for 3 days while symptomatic. So I am encouraging the use of face masks, but for them to be effective, 90 to 95% of the population needs to be wearing them. So it is our last line of mitigation against this virus and the ability to top its spread. If we want to staying open means reducing the spread. And that is why I think it is so important and why it is recommended by the State Surgeon General and by the CDC that people adopt cloth face coverings. I think at this point I'll stop to ask if there are any questions. and we'll proceed from there.
Okay, thank you, Dr. Chapman. A lot of great information there. And I'll start with Dr. Kelly. Any questions or comments you have?
Not for Dr. Chapman, other than to say I very much appreciate all of her clarity, and I appreciate whenever she was asked about contact tracing, all of those specifics. I really very much appreciate those.
Mr. Destin?
Like, speak to contact tracing? I couldn't hear.
I just
Sorry.
said thank you for your article where you clarified contact tracing. That was very helpful.
Yeah, so one of the things that we've talked at length with the school district personnel, and again, remember, we've been working together, and in fact, I have to say that at the beginning of the pandemic, Okaloosa County School District was the first school district in the state, I believe, to get up as much information as they got up. And this was before there was the first case in Florida. So, they were really proactive under the superintendent of getting this information out and starting to educate the children and the families. As we began the discussions in late May, early June about how do you reopen school, of course, at that time we had a much lower positivity rate for the virus. One of the things we discussed was, what are we going to do about children or staff that present sick? And right now, the only guidance we have is that anybody with a symptom consistent with COVID-19, and those symptoms have grown, needs to be excluded from the workplace or school for 10 days from the onset of symptoms. It has now been reduced to 1 day, 24 hours without fever and fever-reducing medicine, and resolution or improvement of the symptoms. So a response to me when I said that was, well, what if that's 30% of the kids or 30% of the faculty? And I said, that is the current recommendation, you would send them home. When it comes to having a case, and we've already have dealt with cases this month, we've seen cases in child care centers, we've seen cases in summer recovery, we've seen cases in recreational programs, we've dealt with cases with coaches of your programs, and fortunately with the coaches in your programs, they were practicing significant social distancing, and so a lot of children were not necessarily impacted. But when you have a classroom with a case in it, it most likely, depending on the age group and the type of interactions that they are having in that classroom, that most, if not all, of the classroom will need to be excluded. And that exclusion for a contact is for 14 days from their last contact to a case. That could be and that will vary based on each individual. So the things we do to control the virus could be, and probably will be, because it's happening in my own workplace and other people's workplace, very disruptive to your day, to your week, to the delivery of school services.
All right, Mr. Destin?
I also want to thank Dr. Chapman for her presentation. It appears that we are in the midst of a firestorm with this virus at the moment, and all that she has told us today supports the decision that we will be discussing later in the meeting to delay opening. It also suggests to us that during that delay we can come up with some of the policies that we're still trying to flesh out. The face mask policy in a school environment is extremely complex and complicated, but it looks like if we can come up with something And I know that we already have spoken about it, but the details, we will have time to flesh out some more details during our brief pause. And so, I want to thank her for everything she said.
Yep.
And the statistics we have in Okaloosa County now lead us to the conclusion that pausing is the right thing to do. After all, safety and health of the students and our staff are one of our number one priorities, if not number one. And to go forward without completely fleshing out what we can do and what we should do would be the wrong thing to do.
All right. Ms. Vanchek. Hold on for a second.
Mr. Bryan, I'm still here. Can you hear me?
Yes, sir. We're Mr. Mitchell's fixing something real quick. Ms. Vanchek, are you there?
Yes, I am.
Okay. Stand by. You're going to be next.
All right, I think, Dr. Chapman, you'll be able to hear us a lot better now.
Okay, thank you.
Can you hear me, Dr. Chapman?
Yes, sir, Mr. Ryan.
Okay. So Ms. Vanchek is up next. Any questions or comments for Dr. Chapman?
Yes, sir, thank you. Dr. Chapman, thank you for joining us today. I appreciate it. I'm assuming you are familiar with the school district's plan for reopening, which has been is being presented to this board that we should have students back to school by August 31st. Is that correct? You've seen the plan?
I listened to, I've discussed the plan I've discussed components of the plan with them, and I was on the call or the Zoom meeting that was
for
held.
reopening, which has been
We had a little bit
I didn't hear what was asked.
Go ahead, Ms. Vanchek.
Okay, it's hard for me to hear her, as I know we're going through several different things for me to hear, but I think she said yes, she's familiar with it.
Yes, ma'am, she did.
Okay, so with that plan and what you have said, I'm just wondering if you feel confident that that is a good plan for us to use.
Well, it's my role to give input on what are the mitigation strategies. Mitigation strategies being cloth face masking, cloth face coverings, physical distancing, appropriate hand washing, appropriate cleaning and disinfectant, and that type of thing. I will say that I have no expertise on how to implement that in a school setting. Those are the parameters that are given, but you all are the experts in how do you live within those parameters and educate kids. And these are difficult parameters to meet. So I would say that some things have to be adapted to your particular physical plants, and I am not in the details of how that is adapted. I also am only here in an advise and educate role. I am not here in a role to tell you how to execute that in a school setting. The Florida Department of Health has I am a part of the executive branch of government, and our role is to serve as a resource to you and help you identify the safest manner and mitigation strategies. That is my role. So I don't get in the business of approving or disapproving of your plans in a public setting like this. I consult and I give my input, and then it is acted upon.
Yes, ma'am, I understand that, and I'm not trying to put you on the spot to say, to give us that, but with your expertise, we are looking at plans, and of course, we need that medical or scientific guidance. For example, looking at a timeline, we would need that to see, we're looking at the date of August 31st, and I'm just having to vote on that. I need to have the information from your expertise as to, would it make a difference to wait that long? Do we need to wait longer? What that means? And do you have any sense of timeline, like a month from now, 2 months from now, that we see some reprieve in what's going on with this virus that would help us to make that decision?
So it is very difficult to forecast the future with this virus. Right now, we are giving the virus everything it needs as a community to easily transmit. So I would say to the community and to all community leaders that, and I've said this in email before, action is needed to get at least 90 to 95% of the population wearing face coverings in public settings where social distancing cannot be maintained. If we get to a place in the next week or two where there's a dramatic change in the behavior of the community and their behavior around wearing masks, and some of that, the leadership is coming from major businesses and saying you must wear a face covering to come into our business, and that is legal for them to do. We will continue to have ongoing transmission of the virus. So if there is, and I again will implore the community to recognize that the face cloth coverings do not inhibit your ability to breathe. They do provide source control for the droplets that come from your mouth and trap it in the mask. They reduce how far they can get out of and away from your mouth. And that is very, very important, because if you've ever seen any of the videos that show the spray coming out of our mouths from either normal breathing, talking like I am now, or talking in a much more animated way, and you're projecting more. And you'd be surprised how much moisture and droplets are coming out of your mouth and nose. That cloth face covering blocks it and blocks how much of it gets beyond 2 or 3 or 4 or 5, 6 inches of the mask. And again, it's distance and time of exposure. And so we've seen in studies that it appears that there is the ability to protect people, such as we saw in the hair salons. So I think, more time to allow us as a community to see if we can have an impact on this virus by more and more and more of us adopting the use of cloth face coverings. We could start to see our positivity rate going down. If we do nothing as a community, we will keep seeing more of the same. So this is, my big implore to the community. It's not just to the school board, but if we want to reduce the transmission of this virus, we all need to work together to protect each other.
Okay, thank you. One other quick thing is, as we're heading back in to school, doesn't flu season come in around October? And that's another concern as we mix influenza time with the continuation of the COVID-19 spread.
Yes, all of us in the public health and medical field are very concerned about the fact that we will enter flu season on October 1st. Now, generally, flu season in Okaloosa County reaches its peak around Christmas time, end of the year, and into January. That is typically, although flu seasons have started as early September in Okaloosa County. So again, what I would strongly encourage is that this is the year to get your flu vaccine. This is absolutely the year to get your flu vaccine. The flu vaccine does not cause the flu. If you get the flu after taking the vaccine, then you already had been exposed to it. It was not from the vaccine. I do know that the school district, I've talked with Mrs. Schroeder, is working with a vendor to bring the flu shots back to school. And so, I strongly recommend basically just almost everyone 6 months of age and older, there are a few exceptions, can take the flu vaccine. And so, yes, it is of great concern. On the converse, could say, and we just don't know this for sure because we haven't looked at cloth face coverings as other parts of the world, that potentially the wearing of the cloth face covering could have an impact on the spread of flu. But we don't know that yet, but it's a possibility.
Anything else, Ms.
So
Evanchik?
yes, I'm not looking forward to flu season on top of COVID season.
Ms. Evanchik, any other questions or comments for Dr. Chapman? Okay. She might have been. Ms. Evanchik, can you hear us? Okay. So I'm going to go, if it's all right, I'm going to go to Dr. White and let him make comments. We'll try to reestablish with Ms. Evanchik if she has any. Dr. White, are you there? Dr. White? Dr. Chapman, hold steady. We have lost communications with our two board members who are at home right now. Yes. We're going to take a recess. And we left off with Ms. Ivanchek. Any questions or comments any more questions or comments for Dr. Chapman?
Well, thank you for your information on influenza, and I heard the piece about the getting the flu shot and so forth like that. So I'm going to sum it up. I know others have questions. Bottom line, in your best knowledge, what is the safest way we can begin school this year?
You know, I am not in the business of educating children, so I don't, don't know the best way to open schools at this point in time, because it's not my field of expertise. My field of expertise is in the mitigation strategies that can be deployed in the school district to improve the odds of keeping it as safe as possible. So, you know, I know the school board and the superintendent find themselves in a situation of a requirement to open schools, and that makes it more difficult. You know, certainly delaying the opening in the hopes that we can get more of the community to adopt and practice social distancing and wearing face coverings and washing their hands and staying home when sick, because people are still going to work when they are sick. Stay home when you are sick. We could turn the tide on this in 6 weeks and at least be able to see a declining positivity rate. So this is a day by day, a week by week life right now, as far as what is the status of the pandemic. You know, we will certainly see when schools reopen, you know, a little bit more about the ability of children to transmit. Some preliminary data that was just released this week seems to indicate that from 10 to 19 or 10 to 18 can transmit like adults. It is not surprising that the very young children may not transmit it as effectively. Very young children are very ineffective in their coughing ability and their ability to spread, their voice, tenor and all. They are very unlikely to spread tuberculosis, so that is not an unusual, I'm not surprised by that finding. So the very young, again, I'm not in a position to say this is safe and this isn't safe, just to give you recommendations on what should be done, what could be done to make it as safe as possible. Excuse me.
Okay, so I think to sum it up, his bottom line is, once we put employees and students back in there, obviously there's going to be some people get sick. Bottom line, it just is going to be, because the virus is not going away. Is that correct?
Well, the virus is not going away, and it probably will never go away. You know, this is where the issue of cloth face masks becomes so very important, along with the physical distancing of 6 feet or more, or the provision of some sort of barriers around teachers and students that allows them to sit closer, but between wearing a mask and some sort of maybe plexiglass barriers, again, we can reduce the risk. We will never totally eliminate the risk. And so, yes, we are planning that when school reopens, that we will see transmission. We have seen transmission in child care centers. We have seen transmission in recreational programs. We have cases in all of those scenarios in the summer recovery program. So again, the contact tracing and the isolation of a case will be disruptive to school as it is right now, to businesses and other workplaces.
Okay, thank you very much.
Anything else, Ms. Ivanchek?
No, thank you, Mr. Chairman.
Okay,
Appreciate it.
Thank you, Ms. Ivanchek. Okay, Dr. White.
Yes, thank you, Mr. Bryant. Dr. Chapman, are you still there?
I am, sir.
All right. Well,
Can
just
you hear
wanted
me?
to say, like the other board members, that appreciate very much what you have done and what you're doing, and thank you for attending our meeting today and for answering the questions that I contacted you about earlier. And just to apologize again for the technical problems. I really appreciate your remarks and what, for lack of any better word, I'll say is dispelling some of the myths regarding the coronavirus, particularly your comments regarding face coverings and masks. I really appreciated the email links you sent, the growing body of research that shows that cloth coverings work in limiting the spread of the virus. And I think you probably must be aware that Mary Esther City Council passed an ordinance last night requiring face coverings. But I have a couple of questions that you might have spoken to that perhaps I couldn't hear, but I hope you won't mind repeating yourself if you did. Could you speak to what I've heard called asymptomatic transmission? Is that real, or does that happen?
Yes, yes, sir, it is real. It is real. We estimate in the U.S., it's estimated anywhere between 35 and 40% of people may be infected, but don't ever develop symptoms. It is, at least based on current scientific evidence, they are capable of transmitting. And so that's why the cloth face coverings are so important, because of that growing group of people that may not have symptoms but do have the ability to spread the virus. And that's why face masks serve as a source control to diminish the amount of oral droplets that are shared between people. So there is also something called pre-symptomatic transmission, and that is for those people who actually develop symptoms. They are able to transmit at least 2 days before they actually feel bad, and so we have something called pre-symptomatic transmission. So, and then of course there's symptomatic transmission, but there does seem to be a growing body of evidence of that the most of the transmission occurs in that early part of the infection.
All right, yes, ma'am. So then I think I understand. And for those folks that are symptomatic, that's when the temperature checks and those kinds of things might be effective in identifying folks that might be ill. Is that correct?
Well, temperature checks, we're certainly, a lot of people have focused on temperature checks, and but temperature is only one symptom of a growing number of symptoms associated with COVID-19. And so it's not necessarily the key symptom for exclusion, at least not for the information that's been provided to me at this point in time. So someone with a headache, or someone with a sore throat, or someone with a bellyache may well have COVID-19, and that's why we would exclude them from school or work until either we test them or their symptoms become better for this whole 10-day period. So yes, it is. It does complicate running a school health room when
Exactly.
the myriad of symptoms that could be COVID. You know, having run the school health program for the school district for many a year, you know, we know that we don't send every kid home who has a headache. In an era of COVID, of a historic pandemic, you know, right now that is the guidance from CDC. That could change in the coming days or weeks.
Who?
Yes, I understand. And so I guess the last thing is, and Dr. Chapman, are you still there?
I am, sir.
All right. And so I understand your comments regarding the reopening plan that the school district is compelled by a Department of Education's executive order to do by the end of August. And I think there are probably a lot of folks that are concerned about reopening or when we reopen. But I think it's important to let the public understand that our reopening of schools is compelled and required by Department of Education executive order. And as you and I talked about, I think you're familiar with that.
Yes, sir. I am familiar with that executive order.
All right. So thank you, Dr. Chapman. And again, I just want to reiterate how much we appreciate you and everything that you're doing to help our community. Thank you, ma'am. Mr. Bryant, that's all I have.
Okay, thank you. And Dr. Chapman, I just have a couple of questions, if I can ask. You mentioned about people who were showing symptoms going to the hospitals. Are we testing people if they have just one, or if they have multiple symptoms when they go into the hospital? Are we testing them for the COVID virus, or are they just coming in maybe saying they have a fever, but then we're sending them home? Are they testing? I guess that's my question. Are we testing for people who have a symptom, or they have to have symptoms?
Actually, testing community-wide is available through our community points of testing for anyone who wants to get tested.
Right.
We have people who've had a recent, contact or been notified. They want to get tested just to know where they stand. And but essentially, it's a very broad and open definition for testing. Because the list of symptoms started with fever, shortness of breath, and cough, but has grown tremendously over time. One of the more unusual is a loss of smell and taste. Each individual symptom can trigger, and we will test. The hospitals have their own protocols for testing, as far as getting people into the hospital, and our hospitals are stressed in that they need to know if you have COVID before you go in. So they are focusing their testing on people who are being admitted so that they can assure that they're placed appropriately in the hospital so as not to infect those who are not sick with COVID, but sick for other reasons. So, but we have quite a bit of access through the health department, in our health department drive-through events, as well as in our community events. So we have access to testing. The testing we have is, there's diagnostic testing. There are two types of diagnostic testing. There are PCR and then antigen testing. The PCR that goes to the laboratories is sort of the gold standard at this point in time. There is a rapid PCR test that our hospitals have to be conducted in a hospital clinical lab or higher. Unfortunately, the ability to get the reagents for that test have become limited due to the high demand. And then the other type of test is an antigen test. It's also diagnostic. It is considered a probable case of COVID-19 by the Florida Department of Health. We generally do not do contact tracing on the probables because we have so many confirmed cases that we have to investigate. So antigen testing is very good for telling you a person is negative. It's pretty good for knowing if you're positive, but you could be negative even though you have a positive. So generally, follow-up PCR testing is done.
Okay. And Dr. White kind of hinted or alluded to a question that I was going to ask you about. I'm just now.
That's all right.
Well, Dr. White asked a question, so I got the answer on that one. So, but again, you know, I know, like we talked the other day, we're both in, all of us are in uncharted waters here, and you know, I truly believe that all of us are trying to do what's in the best interest of everybody, and we do appreciate you being here to share your thoughts and all the information that you gave us today. And again, I apologize sincerely for the technical difficulties, but we are very appreciative that you were here to speak to us today.
And I also want to say a couple
Yes,
things as
Mr.
well.
Chambers does have a closing.
So first of all, the last workshop that we had, as you know, we went over a lot of information about the reopening schools plan. And one thing I always want to make sure that I do is when I'm up here on this board is that I say things the correct way, and that what I say is what I mean. And so I do want to say, just for transparency sake, I want to just read a little bit of a last workshop's transcription. And Dr. Kelly rightfully asked me a question about Dr. Chapman, which I appreciate the question. And I just want to read this. It says, I appreciate Mr. Chambers' comment that he stays in close contact with Dr. Chapman. And again, in these crazy times, that must be done. So my assumption then is that she is fully on board with our plan to open on August 11th. And I said, she's been part of the work group and she has been part of the community group as well. So she's been a part of this every step of the way. And Dr. Kelly said, thank you. I said, yes, ma'am. Dr. Kelly said, and she is in agreement though, right? For us reopening schools, I said, yes. Now, does she have certain thoughts about what we need to do? Absolutely. And we're going to go through some of those thoughts. Dr. Kelly said, okay, thank you. And then we went on to another topic dealing with electives. And I said, and I do want to go back to Dr. Kelly's question about Dr. Chapman. So as we do know, it is mandated that we open up schools. So she understands that. She's a healthcare professional. She understands where we are in Okaloosa County in terms of the numbers, where we are with hospitalizations. So she might have her own opinion on that. But she understands that we are reopening schools, we are opening schools back up, and she has not balked on that at all. But she has given input in terms of safety measures that we have in place. And just going back and looking at that transcript, I probably could have said that a little bit of a better way. And what I probably should have said is that she does not recommend that we either reopen or close. So I definitely would want to mischaracterize your words, Dr. Chapman. So I apologize. I think what I was trying to get at, I know what I was trying to get at, was the fact that we've worked very closely since February together, on the weekdays, on the weekends, part of the work group, conversations, helping us with many documents that we've created. So if I mischaracterized that, Dr. Chapman, I apologize.
Thank you for that, Mr. Chambers. You know, this is an extraordinarily difficult time, and all of you as elected officials have an extraordinary situation that you're in, and I do not envy your positions. I know some people say they don't envy my position, but you know, I'm here to present you with the science, with the knowledge that we have at this time about this very new and a virus that we're learning so much about practically every single day. And so it is very difficult things change rapidly. And so a conversation or a discussion 3 weeks ago could be radically different today. And I know that's really hard on everybody. But that unfortunately is our reality in this historic pandemic. So thanks.
And I appreciate that comment about the conversations, 3 weeks ago are definitely different than today. We've talked about that, and many of our conversations that we've had are different today than they were 3 weeks ago, a month ago, even a week ago. So I appreciate that, Dr. Chapman.
Sure, no problem.
All right. Any other comments or questions for Dr. Chapman? Okay. With that, we're going to recess. Dr. Chapman, thank you very much for being here, and you have a wonderful day.
Thank you for allowing me to speak. I
Okay.
appreciate
Thank you.
We're going to recess so we can do some housekeeping with technology, so we'll be for a few minutes. Staff, we're ready? Okay, I'm going to call this meeting back to order. And we are now at Section 5, Administrative Personnel Appointments. And item 5.1 will be the appointment of Assistant Principal 1, Crestview High School, recommended by the superintendent for approval. And item 5.2, appointment of Assistant Principal 1, Baker School. And then we are at public comment. 6.1, members of the public desiring to address the school board, Form MIS 5241, public input and/or discussion of agenda items. And section 7, committee and staff reports. This is workshop only. 7.1, quarterly report, service agreements under the $5,000 threshold for internal and budgetary funds, presented by Vince Wyndham. And we're at section 8, consent agenda. And school board members, knowing that Dr. Chapman was going to be here today, I had asked that staff call on pretty much everything that was on here with all the contracts or whatever, as far as hopefully everybody kind of reached out. If you do have any questions, please do not hesitate, or comments, please do not hesitate to stop me. So we're at 8.1, approval of the consent agenda. 8.2, approval of the minutes of the special meeting of July 9th, 2020, minutes of the workshop meeting of July 9th, 2020, minutes of the budget workshop of July 9th, 2020, minutes of the regular meeting of July 13th, 2020. 8.3, appropriation of District 1 School Board member capital outlay funds to Pryor Middle School for picnic tables in the amount of $9,639.25. Presented by Dr. Lamar White. 8.4, appropriation of District 1 School Board member capital outlay funds to Lewis School for a front office wall and counter installation in the amount of $4,865, presented by Dr. Lamar White. 8.5, appropriation of District 2 School Board member capital outlay funds to Bruner Middle School for welcome signs in the amount of $675, presented by Mr. Dewey Destin. 8.6, invoices to be approved for payment. 8.7, school donations. 8.8, payroll warrant register and accounts payable warrant register for June 2020, totaling $52,485,282.19, and bank transfers for June 2020 totaling $24 million. 8.9, emergency purchase of infrared forehead thermometers. 8.10, tag-on bid purchase of over $25,000 for Dell. 8.11, tag-on bid purchase over $25,000 AMN Healthcare Company. 8.12, renewal of ITB 19-12 radios, repeaters, and accessories for portable and two-way use. 8.13, exempted purchase over $25,000, Edgenuity Incorporated. 8.14, exempted purchase over $25,000, Max Scholar. 8.15, exempted purchase over $25,000, Teach Town Incorporated. 8.16, exempted purchase over $25,000, N2Y LLC. 8.17, service agreement number 21-41, Modern Therapeutics LLC. 8.18, request for price increase of ITB 18-21, tile carpeting and tile flooring district-wide. 8.19, school readiness provider contract extension. 8.20, school readiness provider contract. 8.21, vehicle maintenance and repair agreement between the School Board of Okaloosa County and Northwest Florida State College. 8.22, sale and disposal of surplus property. 8.23, State of Florida Voluntary Pre-Kindergarten Education Program statewide provider agreement for fiscal year 2020-2021. 8.24, agreement between the School Board of Okaloosa County and the Okaloosa County Sheriff's Office for the Choice Information Technology Institute CSI program at Crestview High School for the 2020-2021 school year. 8.25, 2020-2021 Career Dual Enrollment Articulation Agreement for Home Education Students of Okaloosa County. 8.26, Interinstitutional Early College Dual Enrollment Articulation Agreement between the Okaloosa County School District and Northwest Florida State College for 2020-2021. 8.27, Mental Health Assistant Allocation Plan for 2020-2021 school year. 8.28, Healthcare Service Agreement between MaxVax LLC, doing business as Health Hero Florida, and the School Board of Okaloosa County. And I believe this is the flu shots that we are going to do again this year. And that was something Dr. Chapman highly recommended that we were going to participate in, so this was on the agenda. 8.29, Cooperative Service Agreement between the Florida State University and Okaloosa County School District. And 8.30, Agreement between the School Board of Okaloosa County and the School Board of Walton County to provide ESE services to eligible Walton County students. So now we're going to move to Section 9, Superintendent Human Resource Recommendations. 9.1 and 9.2 will be informational only at Monday's meeting. So 9.1, Employees on Administrative Leave, presented by Dr. Lee Hale. 9.2, Deferred Retirement Option Program. 9.3, Cleared Certification Requirements and Issuance of Contracts for the 2020-2021 school year. 9.4, Out-of-Field Report for the 2020-2021 school year. 9.5, Employment Separations. 9.6, Personnel Recommendations. 9.7, Employee Transfers. 9.8, Reinstatement, Reimbursement of Sick Leave due to Line of Duty Illness, Injury, Medical Examination. And 9.9, Leave Without Pay. So now we are down to Section 10, Discussion Agenda, and we do have 10.1, Revised Okaloosa County School District 2020-2021 school year, presented by Steve Horton and recommended by the superintendent for approval. So with that, I know we're going to want to have some discussion. So Mr. Chambers, I'm going to, if it's all right, I'm going to go down with the school board members first. If you're okay with that, we'll go that way.
Okay.
So any questions or comments? I'll start with Dr. Kelly.
Well, actually, I do, but they would probably be more germane to a reopening plan, but I'll be glad
Okay.
to
Well,
follow those up right
and
now
I
if you'd
think-
like me to.
And I misunderstood Mr. Chambers. That's what we were talking about before. But do you want to go ahead and maybe you want to talk about a reopening plan beforehand?
So that's what we're prepared to do today.
Okay.
And also talk a little bit about the calendar, where we are,
Okay.
but specifically about the reopening plan, as well as discussions about delaying to August 31st.
Okay. And I apologize. You did tell me that, and of course, you know, that's been one of those mornings already. So, Mr. Chambers, I will let you go ahead and.
So I appreciate it. And so as you know, we'll have before us a recommendation to reopen schools on August 31st. And I will say, you know, a lot of time and energy has gone into that thought. We've taken a lot of input from parents, from employees, and we definitely believe it's the right thing to do. But before I get into a little bit about what would happen over the course of the next 5 weeks, which would allow us to do a number of things, I just want to reiterate this process. So as you know, I think Dr. Chapman said today, this is all different. No one's gone through this, at least in our lifetime here. So I think it was very important to make sure that we had the input of so many folks as it pertained to us creating the reopening schools plan. And I just want to go through some of them. Just once again, we've done parent and employee surveys. We created a staff work group, which I think was very vital in helping us make a lot of these recommendations. And that group, many of them gave up their summer to come in and be a part of this group, which I very much appreciate. We've had, when I say ongoing communication with the health department, I think as Dr. Chapman reiterated today, especially over the last several months, there's just ongoing communication, almost daily communication, and even on the weekends in terms of when situations arise. And I appreciate Dr. Chapman, who's helped us revise a number of our documents to make sure that we're adhering to CDC guidelines or just the new information that's coming out as that new information arises. Also, we've met with our principals. Some of them have been on the principal work group, but we've also met with all of our principals as well to go through this and to get input. We also had a meeting where we had SAC representatives on there. We thought it was important for the SAC groups to be a part of this plan, as well as a community group where we had 2 military liaisons. We had each Chamber of Commerce. We had the Sheriff's Office, Gulf Power. We had parents on that group, as well as members from the EDC. So there's a lot of communication that's gone through this process. I believe it was a week ago, could have been about a week and a half ago. Also met with a group of elementary teachers and staff, as well as secondary teachers and staff. Those 2 groups comprise of almost 400 individuals here in the reopening plan. Many of them were able to give questions through the chat box function. So we added a lot of those questions to the frequently asked document that we have, that hopefully people have gone to. So a lot has gone into this plan. So what we will be accomplishing over the next 5 weeks or so before teachers would come back in the proposed August 24th, okay? So scheduling is a big deal. So right now we have about 6,100 students who have declared that they would like to go online. That's about 20%. If you remember, our survey stated that 20% wanted to go online. So right now we're there. I wouldn't be shocked if that number goes up some. But what that means in scheduling is, I drove to one of the high schools and sat down with one of the master schedulers and said, walk me through this. So they literally will go to, this is getting deep, but I want us to understand, they literally go to the pause screen and see the students' actual schedule right now as it sits. Now, those who want to go online, the Edgenuity courses or the online courses for Okaloosa Online may not match their schedule, because some of the courses in Edgenuity or some of the courses on Okaloosa Online, they do not have some of those courses. So now the AP has to have a conversation with each of the 6,100 students. So as they go through that process, they may say, what other elective do you want? Many times the families, they don't want to make a decision right then, and I understand, because they want to go back and say, hey, to their son or daughter, what class do you want? So a 30-minute conversation, some of them are done, but some of them go to the next day. Some of them go to the next day because families are thinking about it, and they should think about it. So scheduling is a big deal as we go through this process to make sure that we get these students scheduled in courses that make sense. And when you look at some of these courses, such as IB, we have kids who have been in a program for 3 years. And we need to do everything that we can do to allow those kids to finish. Or we have some students who take almost all AP their junior and their senior year. We have to do everything that we can do to allow those families, those students, to take the courses that they would take, because it's college, as you know, is competitive.
Mr. Chambers, can I ask a question real quick? So the courses that are not being offered through Edgenuity, could you maybe elaborate what those courses are? Are those more like the hands-on courses, or probably that like technical side of things and all?
So absolutely, and I'm going to ask Ms. Lightbourne to come up and give more specifics on that.
Okay. I think that's been probably all of us have probably received emails on
Absolutely.
why those are not available. So.
Can I just go, are you fine with me, you want me to answer the question?
Just answer this one, and we're going to come back.
Okay, so many of the courses are CTE or AP courses that have lab components. That's what we're finding. We are giving parents the option of My School Online, Okaloosa Online, Florida Virtual, any place we can find those courses, we'll lead them to those. AP Chemistry, which is my passion, that's what I taught, it's not available. It's not available through Florida Virtual School either because of the lab component. AP Physics is not available because of the lab component. So those are courses that we're working with those teachers right now to see, can we do it synchronous, but how can we even do it synchronous if the lab component is such an important
Right.
piece? And that's a college board requirement. I know when I taught AP, you must do those labs, you must complete those labs. So that's something that is right now one of the things that we're working through. We're trying to find a way to be able to offer some of those, but those are a little bit difficult.
Right, and I think that's, good to know, because then that, parents can talk with their students, and, even though they might be doing a lot of classes online, I would hope that maybe they would consider, if that's valuable and important to them, maybe allowing them to would they be able to come to that class, for instance?
So for example, if they wanted to do online and they wanted to take AP Chemistry.
Right.
And it's not offered like it's not, they could come to the school for that one period. They have the ability to do
Okay,
that.
okay.
Some have chosen to do that, and
Okay.
some rightfully are not.
Okay, but that's good to know, they have the choice.
Yes, sir.
Oh,
Okay,
absolutely.
all right.
Yep.
And before you leave, Ms. Lightboard, you might elaborate, or you might not. So CTE is another one, such as automotive or welding and some of those other courses. It's obviously difficult to do through some of the online pieces because of all the hands-on work that those students do. And some of them have been on this track, so I get the frustration in terms of where we are in the country, but it's difficult to offer them online.
Right.
Absolutely, and I want everybody to understand that we've tried to be as flexible as possible in many different ways. So right now, high school's our biggest area because of the electives, right?
Right.
So a student could cut the guidance counselor or the AP's on the phone with the parent. They say, okay, I'm going to take my 4 core on my Okaloosa Online. So okay, there's my 4 core. Now I need to look at my electives. Well, my school online doesn't have that. Okay, so then we look at Okaloosa Online. Do we have it there? Yes. So then we slide that in. Then there's another elective. Well, Okaloosa Online doesn't have it either, so can we look at Florida Virtual? Yes, so we can slide that in. Oh, and I want to come to band, so can I come to school? I want to be there in the physical component of band. Yes, you can. So a student could literally be in My School Online, Okaloosa Online, Florida Virtual School, and in the brick and mortar if they choose to.
Right.
That's up to them. So that's what I think is something that I'm not sure everybody understands, but we've tried to be as open as possible to give all of those options to meet everybody's needs that are out there.
All right, thank you, Ms. Lightboard. Thank you, Mr.
No,
Chambers.
thank you, Mr. Bryant. And that example that Ms. Lightbourne just gave about those 4 different modes that someone might choose to learn, that's exactly what our APs are going through right now, where it's a 30-minute conversation and maybe a decision's made, and maybe not. And if it's not, then it's coming back the next day or later that day, and even sometimes, as they've shared, 3 days or even 4 days later. Once again, and parents, they should take their time to make the decisions that they need for their students. But this is a very lengthy process to get these schedules done, and they need to be right.
Right.
And I do want to say, I want to thank these APs. Many of them are working 8 o'clock at night, 10 o'clock at night right now. They are working extremely long hours, getting there early, working extremely long hours in order to get these schedules ready. And I know Dr. Kelly, Dr. White, I know you all have had your hands in master scheduling before. It's time consuming. And then take what we're doing right now, it's times 2, it's times 3. So I thank the work that they have done at all different levels.
Can I just make a comment?
Yes, ma'am.
First of all, I appreciate that explanation, Sheila. That's very good. I have a concern about families who perhaps don't have the transportation. They might love for their child to come and participate in that class, or they might love to have some of those other opportunities, but they can't. They just simply don't have the wherewithal to get them there. or the wherewithal to sign in, sign out from multiple platforms and get this all accomplished. So I know that we'll be having other conversations about those, but I know that we've had principals in the past that have allowed kids to come in who were homeschooled to take a class or on hospital homebound or other things. So I know we do all that we can to make everything affordable to our students and available. So I'm very appreciative of that.
And thank you. And I also want to thank you, the board members, because I know you've had a lot of conversations with these families, especially as it deals with the courses. And I know you all have tried to help as well. So once again, I appreciate that, because this is it's a big deal to get these schedules correct. Also, during this 5-week period, we're looking at supplies coming in. We're looking at devices coming in and arriving. And as you know, right now across America, everyone's ordering the same types of materials. So some of our materials have come in, some are not in yet. One example is barriers. So we will be looking at barriers at each of our tables. So that's going to take a little bit of time to come in as well, and dollars.
Are you talking about the plastic barriers?
Yes, ma'am. Yes, ma'am.
How much are they, if I could ask?
So, Mr. Horton?
Different models.
We work through purchasing and we get different quotes, but I wanted to share with you some things that we've ordered a few hundred of these already, because in certain circumstances with ESE students and where a teacher needs to be close to a student, these come in handy, and so we do have some of these in supply. This particular one now, it's opaque. You can't see through it, and that's not what we want. This particular company has a clear version as well, and it comes in different sizes. And so we like this because it's flexible in terms of how you can construct it. When you go into our elementary schools and look at our kindergarten tables, they're about the length from here to here, and 2 kids sit side by side. And really, we don't want them sitting end to end, because then they're facing each other. So the guidance is they all kind of face the same direction. But then this piece here can be converted into a T, where it kind of goes across in between the 2 students, and so you can get the same, a different purpose out of it, so you can use one of these for 2 students. So those are some of the things that are going on, and again, these are being requested. I think I was looking at St. John's; they ordered 30,000 of them as well, and so I think they're waiting on them to come in. But that's kind of the plan in terms of student seating area.
And they're inexpensive or very expensive?
Yeah. Well, this piece right here, they sell it by the sheet, and it's about $8 per sheet. So there is a cost to them when you multiply across the district. Now, so they're not inexpensive.
We're able to use our CARES Act money for those?
Yes, ma'am.
Okay.
Yes, ma'am.
And I would say the first one that Mr. Horton held up. So actually, let me back up. We've actually had some employees build some of these, but at the same token, we want to be sure that we're getting them from individuals where this is their profession, so we can make sure it's done right. But we've had individuals build some. Mm-hmm. The one on the ground, the plastic one, is more expensive than that one. But Mr. Horton, we believe that one that Mr. Horton has in his hands might be multi-purposed and give us more flexibility to use with kids.
And we actually have, our maintenance folks are doing some building of plexiglass barriers just on the side. And so I know we've brought a couple out to each front office area where we see the most traffic. And of course, in those schools where we have single point of entry, we've got a natural barrier there for folks coming in from the outside. And so they've done a great job too in kind of getting resources and making those. And I wanted to show one other thing. We also know that there are lots of times, I know Dr. Chapman talked about masks, there are lots of instances where we need to see a student's mouth, a face, whether they're getting speech services or something like that. So these face shields that kind of operate with a headband, child size, and I would say middle school, high school, and adult size. So we've purchased, at this point, 5,000 of each of these to be able to use throughout the district in places where it's appropriate. And so it would have a similar impact to one of these barriers.
And if you also would, so we've had, as you know, just like you all, our board members, you get a lot of suggestions from parents, from the community, which is excellent. And one of the suggestions was to make sure that the masks that we have, some of them we can see through those masks, because it's important to see the face, especially for some of our ESE students. So I didn't even realize that existed at the time. So we have, so I asked Mr. Horton to look into that, and rightly, he has it already. So this is just another example of listening to our community. All right.
All right, thank you. Thank you, Mr. Horton.
Also, part of what we will be doing over the course of the next 5 weeks, and Ms. Lightbourne later will go deeper. She'll go deeper into this topic, but the virtual education, and Mr. Horton, Mr. Mitchell will also go deeper into this topic of the virtual education, where you might Zoom into a classroom, or where Mr. Destin might be the teacher and he's in a room by himself, but he's teaching a class via Zoom that's at home. They'll go a little bit deeper into that, but there are several challenges to that mode of instruction. And I know there are some, and I understand, who believe that we should just be able to do that easily. So it's not necessarily an easy task. And Mr. Mitchell or Mr. Horton, when they come up, to be able to do that across the entire district is almost impossible with the bandwidth that we have. So we have to be judicious and smart about courses and do it where we can do it feasibly. But that's what we're working through as well. Many of our parents have asked, we need this option for the example like I gave earlier, such as IB, and we need to be able to provide this option where we can.
Well, and I think too, if I might, not just for those examples, but that would be an excellent example, those classes that we can't find anywhere else. But a concern I have, and I think I heard Dr. Chapman underscore today, is that if we have an outbreak and we have these students in and out, if I'm an instructor, how difficult is it going to be for me to keep up with that kind of sliding enrollment of students in and out, in and out? So I'd love to see us have some kind of well thought out plan for how to keep those students up to date on their instruction without it overburdening our already taxed instructional staff.
So I think you'll hear a little bit of that later with Ms. Lightboard, and then with Mr. Mitchell / Mr. Horton comes up, and and I wish I had an easy answer where every student had the ability to do that right now, but there's not an easy answer to
any
that.
of these, I know.
Also, we will be over the course of the next 5 weeks, looking at our plan that we have for the training when our not only our teachers come back, but our ed support that comes back, our bus drivers that come back. So we'll be enhancing some of those measures as well. Pre-planning will be different based on the calendar. It'll be different with your approval. It'll be different. So the training will also be detailed in terms of the things that we need to make sure that we hit. So principals will get a number of talking points to ensure there'll be some videos that will be done as well. So we need to equip not only our teachers, not only our ed support staff and our principals, but we also need to educate and help our parents and students. So that's part of what will be occurring over the next 5 weeks as well. Then you look at courses such as band and chorus. So on the 25th of this month, if I'm getting that correct, Ms. Lightbourne, so on the 25th of this month, there's a new study that's coming out, and my understanding is called the SPIT study, and I never knew there was such a thing called the SPIT study. One's already out, and there's an updated one that's coming out. So band instruments, as you might know, they expel droplets, okay? So, but they also come out the little hand thingies, I don't know what those are, but they come out of that as well. So we've gone through the process of getting these little coverings that can go over those instruments. So we've worked with our band directors. We've worked with our choral directors. Several meetings. Lisa Tucker's done a great job with band and chorus. And I want to thank our band and chorus directors, because they've been phenomenal helping us navigate through this as well. But chorus, as you know, when they sing, they say us when we speak. You know, droplets could go out 6 feet. Chorus, it could go out 15 feet. So we're working through that process and have been working through that process with our band and chorus teachers. But this will also give us the ability to hopefully get to a spot where chorus can sing. Right now, there's a recommendation that they do more music education during the first 9 weeks, but we'd love to get to a point where they can sing, where they can spread out. Some of these face shields that we've also acquired, you know, do they wear some of those face shields during chorus? Band, the same thing. Do we spread out into different areas of the school where appropriate? So that is a piece as well. So these are just a few highlights of what will be occurring over the next 5 weeks to make sure that we are ready to open school on August 31st. But what I wouldn't want to say is that August 11th was going to be the first day of school, and as you know, our principals, our teachers, our front office staff, they'd be ready. They'd be ready. This gives us an ability to be a lot more precise with our reopening of schools. And if you don't mind, I'd like Ms. Lightboard to come forward and talk about the curriculum aspect of this reopening plan in detail. And then I'd like Mr. Horton afterwards to come up and talk about some of the technological implications of this.
Okay, Ms. Lightboard?
So if you guys don't mind, I'm going to take you kind of from the beginning, okay? So
Well, I think this is important that that's exactly what we do, because there's hopefully a lot of people watching this morning.
Yes,
So,
sir. Okay. So when we knew that the possibility of coming back to brick and mortar and being online was our possibility, we started researching some other programs. As you know, the 4th 9 weeks last year with elementary, we used a program called Odyssey-ware, and it was really, it met our need, but it wasn't exactly what we wanted. So that was a big search for us, was to find a program that was DOE approved as a full online curriculum, so any student in the state of Florida could use. So that was when we started researching Accelerate. We started researching K-12 education, looking at the costs, looking at the rigor in the programs. Our work group, we had a large work group, and then we brought that work group down into just a curriculum work group. And that curriculum work group was made up of teachers, admin, union members, et cetera. So we got those programs, Accelerate and K-12, gave it to them, gave them a week or so, dig deep into it. We had accounts that they were able to get into and look at the rigor, look at the alignment, look at the cost. I mean, we have to be fiscally prudent as well. And so they did that. And during that time, we had a lot of discussion about both programs and settled on the Accelerate program. So that's the program that we'll be using in elementary. It is now owned by Edgenuity. So Edgenuity is the umbrella. So you'll hear Edgenuity a lot, but it is a separate program that Edgenuity has acquired. During that work group, we worked to develop what instruction would look like for teachers, what it would look like for students, how we could align that curriculum, and I'm going to talk about both. So we've got the Accelerate curriculum for elementary, we're using the Edgenuity curriculum for secondary, okay? So how can we align that curriculum so that ease, Dr. Kelly, that you were talking about, of moving in and out of the classroom, because we're all aware that that's going to be a very real possibility, will happen. It'll be easier for teachers. It'll be easier for students. So what we're doing, what we've done is we've asked teachers to join us, put some work groups together, looked at each of the grade levels in elementary, looked at content areas in secondary, and have aligned our brick and mortar curriculum and our online curriculum so that it's an easy transition. During the brick and mortar instruction, what will happen is our teachers during pre-planning will first of all be whether they're going to be an online teacher or not, because at some point you may be an online teacher, will be trained in both of those platforms, okay? The teachers will then have the opportunity, and our suggestion will be, we'll be pulling lessons, which ones would be the most critical. But with the pacing together, the brick and mortar teachers will do lessons out of those online curriculums as well in the classroom with students. So both the teachers are familiar with the platform, the students are familiar with the platform. The curriculum is good. There's nothing wrong with the curriculum. It's a very good curriculum. So just another avenue, another piece to use. So while that happens, that'll keep everybody kind of together, feeling comfortable if I have to go out for 2 weeks. So then the next piece, this is what makes it easier for teachers and students, is now something happens, my class has to go out for 14 days, 10 days, whatever it is. And the teacher then has the ability to say, okay, go to Edgenuity lesson 2.2. That's what you need to work on during the time that we're out. If the teacher's not the one that's ill, the teacher will be able to have some Zoom lessons with those students at that time to keep the curriculum rolling while they're out. Come back in. Sure, there may be some folks that aren't going to be able to get on every time there's a Zoom. We know that. That's the reality of life. But they will work through those things with them. Sure, there will probably have to be some review of that curriculum when they get back into the classroom, but we feel like we'll be pretty much in lockstep and keep the ability to keep on moving to the best of our ability. So that's the plan, brick and mortar and online together, making that connection for people so that we can continue to move forward in our curriculum and not miss educational opportunities with our students.
Okay, can I ask a question?
Mhm.
I know I got many conversations about the disappointment with Edgenuity. So I feel like maybe you're saying that Accelerate is more rigorous according to
so there's
those
two.
who looked at it.
So OdysseyWare was what we used for elementary. Now we will use Accelerate. The work group that looked at it, like I said, comprised of many teachers and union members and administrators, very
were
much
comfortable
like
with
the rigor, and felt like the rigor was more in line with the standards than OdysseyWare was.
That was going to be my second question. So all of these are aligned with the standards, and teachers are still doing the lesson plans and listing the standards, or are they getting some reprieve from that, or?
So we'll give teachers, that's part of the training too. The teachers will be getting new pacing guides. I think we've lightened up on lesson plan requirements over the years anyway, so I would assume they're still going to need to have lesson plans because they need to know where they're going and what direction they're going. But with a pacing guide, it will be pretty easy for them to be able to do that. So, lesson plans used to have to be required once a week. That hasn't been a requirement in several years now. So they have something available. So if a principal walks in to do a walkthrough or something like that, there's something there for a principal to see. What are you doing? What are you supposed to be working on? That's it.
So go into the virtual education.
I am. Let me just say, I just had notes. I want to make sure I hit everything. Oh, okay, I will. Can I?
Yes, ma'am.
Okay. I also wanted to say some of the things that we're doing, and I'm kind of giving a big overview, and then I'll get a little bit more detailed, okay? So some of the things that we're doing that we think are very, very important that people need to understand is in our secondary schools. High school, we had 7 periods. Middle school, we have 6. So we've gone to block scheduling. But what that means is we're not doing alternating days as far as you're here one day and you're not another day, because we're required to be in school 5 days a week. But what it does mean is that they'll go to 3 or 4, depending if you're middle school or high school, classes a day for double the amount of time. So that means that for a teacher and a student, they're exposed to half the number of of people that they would have been exposed to. So we felt like that was a really big deal to try and reduce the exposure of students, as well as reduce the exposure in the hallways, because you're not in the hallways as often. So that's a big piece, I think, that people need to understand why we're going to block scheduling. And it may be for just a year. It may be everybody loves it. I know we did it when I was a teacher, and I absolutely loved it as a chemistry teacher because I could accomplish more.
And I was going to have you clarify that, because this isn't unprecedented in our district. I know schools have done this
absolutely.
before.
Yes,
So,
yes.
so for those people that are watching, and I understand there's quite a few people watching right now,
Mm-hmm.
block scheduling is not something new. It's been done before in the school district at
Yes.
different schools.
Yes.
So,
And so let me just clarify just a little bit more. So in middle school, with 6 periods, they would go to 3 periods a day. So it might be 1, 3, 5. On Mondays, 2, 4, 6. On Tuesdays, and Monday, Tuesday, Wednesday, Thursday are the same. So Monday, Wednesday is 1, 3, 5. Tuesday, Thursday is 2, 4, 6. And then those stay static. And then Friday is an alternating either a Monday or a Tuesday. And I think we've worked through, Holly too is our expert in working that calendar out, and we've worked it out so that it comes to an even number of Mondays or Tuesdays on the Friday day. Does that make sense to everybody, what I'm trying to say? Okay. And then high school, remember, because it's 7 periods, it'll be 4 periods, but 3 will be block and 1 will be a constant period. So there will be 1 period every day that stays every day for 50 minutes, because we have a 7 period day here. So I just wanted to make sure everybody understood that. Okay?
thank you for clarifying that.
Yep. So in our brick and mortar, and I've kind of said some of these things, but I wanted to make sure that everybody understood that all teachers will have the online training so that they're prepared if they have to move out of the classroom at any time. The monthly lessons on the online within the brick and mortar is important.
Ms. Lightborn, real quick on the training aspect of it.
Yes, sir.
What is the time frame from, how much time do they need to be properly trained on?
So what we're looking at is, first of all, our teachers come back August 24th. That's
Right.
when we have the ability
Right.
to touch them. We're putting out weekly kind of COVID updates right now. Terry Schroeder is doing that in conjunction with the health department. So those kind of updates are going on right now. The actual online training, if you're going to be an online teacher, that's a 3-day full training.
Okay.
For our teachers that are in the classroom, it'll be more of an overview. So that'll be probably 1 hour to 2 hours of a whole training day that's just on the platform. So that's what we're looking at.
Okay, thank you.
Can I ask a quick question?
Absolutely.
We're talking about bringing the teachers back on the 24th?
I believe the 19th is flex days. And this is all tentative in the calendar that you guys are going to look at. And I believe the union is still looking at that. So I don't want to say, for sure, but I know that's what possibly is being proposed.
And my question would be, since they do have so many more new things to learn, and after all, when they get into the classroom, they're actually going to be able to get their arms around safety protocols and how they might best be implemented in their own classrooms. Why don't we bring them back a few days earlier? Most of them that I've talked to are willing and probably think they need to. Is it a salary? Is that a component? Why are we bringing them back only a week when that's what we did back in the good old days when things were infinitely more simple?
So actually, I believe there's more days during this pre-planning than we've
Okay.
had previously. There's the 3 flex days, which is in their contract. So
Right.
they'll be back those 3 days to be able to work in their classrooms, do what they need to do, their normal routines. Then we'll have 5 days of what we call touch days, where administrators can do PD faculty meetings and all of those things, which is more than, I think, at least a day more than normal.
Okay,
And
well,
I appreciate that answer, but I want to go just in good answer. We're gonna go a little bit deeper as well. So whether Rita, Dr. Hale, if one of you come forward.
and thanks for the answer. I think some of them are still a little confused about, when it is they're going to come back and what.
Well,
So that helps.
Correct.
It's all still up in the air, I understand.
Good morning, and Mr. Destin, the question that you pose is exactly what the union and I are looking at. They have expressed to me the willingness to look at teachers reporting a little bit earlier. The concerns that we definitely need to address as we are looking at these is the appropriate amount of student contact minutes and the appropriate amount of days to keep the teachers within their 196-day calendar. And so we're looking at some nuances. There are some conversations going on with regard to potential my term is like get back days, which holidays do they want to look at, and things like that. We need to ensure that we are keeping 196 contact days for the teachers, pay days for the teachers inside the schedule too, but also accommodate those student requirements that we have to do to meet our statutory requirements. Now, there has been some mention by either the governor or the commissioner about a little bit of grace with the 180-day rule. Our calendar was already 179 student days because of our instructional minutes. I know that Ms. Meserve and MIS is looking very carefully at exactly what that means, the grace that we were given, but at the same time, we're continuing to make sure that our instructional minutes fulfill exactly what they need to for students as well. So exactly what you mentioned is exactly what the union and I continue to talk about even today. There is a potential for bringing them back a little bit earlier, but we need to ensure their contract and the student minutes, and
Well,
that's
good.
what we're looking
I
at.
would think if there's any situation that ever required grace from the Tallahassee, this is it.
Yes, sir. I agree with that 100%.
And Dr. Hale, and you may or may not know this right off the top of the head, but let's just say that we brought the teachers back 10 days. Okay, so we brought them back an extra 5. So what would that mean in terms of the calendar?
Okay, so potentially, if we brought the teachers back 10 days early and still afford them their 3 flex opportunities, the calendar would necessarily shift either back in terms, because we still have to, we'd have to look at how many student days we're giving away is essentially what we would do. I can foresee having to go to 174 or 175 student days, and whether or not that's legitimate would be a concern. But certainly if that gives us the opportunity to get our instructional minutes in and bring them back earlier, and if that's what it takes to get them trained appropriately, that's what we would be exploring.
And I asked that question because I'm sure you received some of the emails as well. As you know, we've had students out of school for a while. Some of our free and reduced lunch kids, some of our students who just might struggle. I know a number of families are very interested that we do not cut days from the instructional actual touch days because they want their students to receive as much instruction as possible. So I think we need to be very mindful of that, but do a very good job during those 5 days, which is more than normal in terms of touch days, to train and do the things that we need to do to open up safely on August 31st.
Well, I would think that, if we have to add some touch days at the end of the year, then that's just what we have to do.
Yes, sir, and I might also just add one other thing that we're having to consider as we are looking at some of these things is, well, I will just say the first thing is the state has not backed off the fact that our state assessment calendar is still in place, and so those will necessarily interrupt instruction to some degree, as they always do. If there's some grace given towards state assessments or something like that, there may be some additional instructional time within our given minutes to get back some of that face-to-face instruction and things like that. But those are some of the things that we're talking through with the union. So your point is very well taken, and that's exactly what we're exploring right now. But I can say that in terms of no matter what the calendar looks like on the front end, just as you suggest, it's necessarily the back end that would be impacted by those decisions. And so I'm grateful for you opening up the door to that ongoing conversation, as that kind of bears itself out. So
Thanks.
And have you any consideration for the 12-month people in the calendar changes? Will this impact them in any way?
I do not anticipate that. However, I think that would be more of a
We have
more
a
of
specific answer to that. Reed has
payroll.
looked at that.
Yeah. So I'm sorry I don't have that.
We're going to have to do
Thank
13
you.
months, right?
I have a question, please.
Hold on for just a second. Dr. Kelly's asking a question, and Ms. Scallon is going to answer that, and then I'll come to you, Ms. Ivanchek.
And
Thank you.
Dr. Kelly, help me clarify exactly what your question is.
I was just wondering, because we were talking about instructional personnel who have summers off, basically, if the new calendar were to impact the 12-month employees?
I mean, it will not impact the 12-month employees from a pay standpoint
Okay.
or from a number of days worked. It may affect duty days depending on the days that have to be shifted, like in a holiday period. But other than that, it would not affect them.
But they won't have a negative impact as far as
Pay? No.
days off or holidays or anything?
Well, I mean, they will get their holidays just as normal. Now, if you're talking about like potentially at Christmas, we get X number of days, but those are not working days. Those are non-duty days that are
Right.
built into the
Right.
calendar. And just like Thanksgiving, it's the same way. So depending on what the outcome of the schedule is, we may have to not have 2 non-duty days during Thanksgiving because those would be days that students may be going to school. So of course, all 12-month employees would have
So
to be
they would
there.
be
But the
impacted in that
calendar,
way.
well, the calendar will be built to where those are not non-duty days. I mean, their pay doesn't change, but they would not have those non-duty days during that period because the calendar's changing.
Okay. So they will be somewhat impacted, but it will be built into the calendar.
Right, and that can occur at any time, any year, and we used to, in previous years, up until the last, 4 or 5 years, that we did not get the whole week of Thanksgiving off. So it can change.
And don't go too far,
Okay.
Rita. But before I say my statement, I think Ms.
Yeah.
Ivanchik had a question.
Ms. Ivanchik, go ahead with your question.
Well, my question kind of goes back to what Dr. Hale was saying on personnel, because Mr. Chambers mentioned at the beginning of this that we have to date approximately 6,100 requests to go online, and of course we don't know which way that's going to go if it gets opened up. How are we determining which teachers go online, and how will that be done? Will that be the principals deciding? Will it be done on seniority? How will we determine who's going to be in the building and who's not?
Yes, ma'am. Thank you for the question. One of the things that I would like to let you all know with regard to many COVID-related issues and union interaction, we are kind of talking through a bunch of those things right now. One of the things that I feel comfortable talking about with regard to some agreement with me and the union is how we do make those selections, because they were interested in that conversation, as was I. I think the most important thing that you need to know before I talk to you about the prioritization is that we did not have a significant, and by significant, everything's significant, but we have a relatively small group of online instructors through our principals reaching out to them that indicated that they preferred to be all online. Right now, that's a total of 129 instructors across the district, and within those 129 instructors that specifically reached out to us, well, actually I would say 139, we're trying to make telephonic contact with each person to make sure we know exactly what their reason is, so we can know how to do the prioritization that I'll cover in just a moment. But so there's 10 that we are still attempting to make contact with, but of the 129, they all have some type of concern, whether it be age, whether it be health, whether it be someone in their household that has a health condition or something like that. And so the first comment is that I can easily foresee there being a need to reach into the brick and mortar to find enough instructors to cover the student online requests rather than the opposite. So I guess the moral to that story is if we can make all the certifications work out in secondary the way they need to, those that have expressed a need to work online will be accommodated without needing prioritization. But I can foresee a certification issue becoming something, and so the priority that we have come up with does matter. So
elaborate, just for the public who may be watching as well, elaborate more on the certification.
Yes, sir. So with regard to the prioritization, and that is a category, and I'll hit it extensively when I get to it, But the union and I both agree that we need to afford the first opportunities to those that have the autoimmune concerns and the age concerns. And so those were the first priorities for everyone. But we also have to make sure that we are keeping people in field where possible. And by in field, that means teachers are required to hold certain certifications to cover certain courses. And so that is another necessary prioritization for certain needs. I can tell you right now that we have, in the core areas, there are many more requests for students than we have teachers to fulfill because of the certification piece. If there's an Algebra 1 request out there, we would necessarily need to have someone with the appropriate certification teaching that course. So that's what the certification piece means. So what we are using as our priority after health and age, we are looking for those teachers that commonly teach the course that's being requested within that population. So if someone routinely teaches Algebra 1 and there's an Algebra 1 request out there, it would make sense to give that to them. Now, if the requests go into a place where it's not routine, then we would look at certifications. For instance, if there was a request out there that required a biology certification, but a teacher doesn't routinely teach biology but has it, then they would need to fulfill that. So we have to make sure that we take care of our employees and the certifications first. And so after that all bears itself out, the numbers will still likely dictate that there will be a need to reach into the brick and mortar because we don't have a sufficient number of necessary online need to fulfill those. So that's the general prioritization list, but until we get the complete student numbers and the complete student roster and literally look at student by student, school by school, available teacher that's there to do that, I can assume some anomalies will come out and then we'll have to make a decision, and likely, all things being equal in terms of prioritization, I can see a continuing service final characteristic being the deciding factor, because you have to have something to fall back on when all things tie. And so I think that continuous service would be that final tiebreaker.
And Dr. Hale, so
Yes, ma'am.
all of those teachers who have requested to teach online have been notified that they may teach online? Are they still outstanding?
Our HR group right now is contacting each one
Okay.
to make
I
out what
thought
the
I heard you say
determinations
that.
and tell them about the eligibility. And then once the notification happens, we would have to, and this is the complicating factor, is that we also have to notify not only the employee, but also the master scheduler at the individual school,
And
because
the
they have to make the
principal.
accommodations too,
And then
and the
Sheila
principal.
can't train until she has your list.
Right. So, and I can tell you that we have already begun discussions on what that's going to look like, and it's going to, in my mind, it's the old coffee rolled up, smoke-filled room where we're all got the big whiteboard and doing the markers, and we've got that planned to begin as early as next week.
But
as
you have a projected end date by which time all of those who requested to teach online will have been notified that they will be able to do that.
Well, I had one in mind, but then with the noted pushback date, we're going to have to reevaluate that. But yes, what I don't want is the employees hanging out there on a limb waiting to know.
Exactly.
And so what my HR group is telling them as we are making contact, asking about the various needs that they have, we are saying we're keeping them pretty transparent with regard to the possibility, but we're just not committing, because until, like I said, these numbers indicate that probably everybody that needs to will be able to. But exactly what that looks like is what we have to wait
But
until
they
it
should
shoots
have
out.
they should have had a contact from someone in your department by the end of this week or by the end of next week, or.
Certainly by the end of next week, because like I said, we have been able to contact all except for 10, and our initial reach out just didn't, it was either a left message or an unreturned email, which we'll continue to work on, so.
10
So
is a
of-
pretty good number.
I'm sorry, I apologize. Of the 139, you've made contact with how many?
129.
Okay.
But I will say this too. One thing that I neglected to mention, that we have gotten information from other people that don't necessarily have to, but are willing to, in an unsolicited way. So there's also a population of those people that we have on the side that have actually contacted us. So that number, will take us up above 160 of available. And I can assume that people that just haven't reached out yet, there are still some willing people to do that.
And
Mr.
one of the questions was still on the calendar.
Hold on. I think Ms. Ivanchek, did you have something you wanted to add? Ms. Ivanchek?
Yes, please, one more, yes. one more thing, Dr. Hill.
Yes,
So
ma'am.
in the maybe perhaps rare situation that, for example, I was an English teacher, there are two English teachers that want to work in the online program, and you only need one, let's say, would then you go to contract language on, say, seniority and that kind of thing?
Yes, ma'am. As I said earlier, I guess I kind of faded in and out on that, but all things being equal, the last thing that we would use would be like a continuous service date, which would be the seniority piece. Yes, ma'am.
Thank you. That's all.
Okay.
Okay.
Mr. Chambers, thank you.
And I know Sheila's still up on the curriculum side, but the
We've moved her all
but
around.
there was a question about the calendar as well. So Rita, I would just like you to come forward and just kind of explain from the finance perspective, which I know all of you get, but I just want to make sure those watching get from the finance perspective. Why is it so important that the calendar is right, that the number of days are right on each side of the calendar? Why is that important?
I mean, that's ultimately important because it affects our budget and it affects the collective bargaining agreement, and it affects our what we're able to pay, what we're not able to pay, and to make sure that that we all know who's going to work, when they're going to work, what their start date is, what their end date is, what their holidays are, what their duty days are, what their non-duty days are. That's why it's important to have those calendars.
Thank you.
Before I go back into the curriculum, one of the things that we're working on with this teacher situation and student situation is pairing up and trying to maintain the teachers, let's say at Choctaw, teaching Choctaw students, but they have to have a full load. So there is a possibility that in some courses, if there's not 150 kids that are needing Algebra 1, then there may be some kids that we put together from Choctaw and Fort Walton. What we've always said is that our teachers and our students will have an Okaloosa County teacher. So we are making every effort for it to stay school specific, but in some courses, you're just not going to have enough students out of one school to make that happen. So that's also the puzzle that we're working with right now, and getting that put together. So I wanted to, since we were on that calendar piece, I wanted to make sure everybody understood that. So I also wanted to talk about, get back to curriculum, some of the things that we did in the CARES Act, because the big piece of the CARES Act was closing the gap. And all of our students, unfortunately, we believe will have some sort of a gap. Whether they're a struggling student or a high flyer, they weren't in school. I mean, they had some education, but they really weren't in school getting what that face-to-face teacher is able to do for a student. And so we looked at iReady, and I know you guys already know this, it came in front of you, but we purchased iReady for K through 8 for our progress monitoring tool, so we can progress monitor K through 8, ELA, and math. And then it will also be an instructional tool in elementary. And I'm telling you that up front because when I get to the elementary part, that's part of the 1 hour face-to-face instruction that will happen in the online program, which is different from what happened in fourth quarter. So there's lots of differences that are going to happen in that My Online School option than happened in fourth quarter. And a lot of folks really need to understand that piece, because I think students will be getting more attention by their teachers and more differentiated attention as possible, if it's possible for them. So that's also the other side of that. Okay. So I want to talk a little bit about My School Online. So the My School Online is ours. It's what we're trying to keep students connected to their school with. So if I'm a Choctaw student, I am still a Choctaw student even if I'm online. I will get all of the messages that go home. I'll get emails with anything that would normally be printed and go home to a student backpacked home. I'll get all of that through My School Online because I am a Choctaw student. I'm registered as a Choctaw student. Okay, so that we felt like was really important. In My School Online, there'll be daily attendance, so they will have to check into the program daily in order to show their attendance. We'll have the same grading expectations as the brick and mortar. So in fourth quarter, this is what's different. In fourth quarter, grace and compassion was overflowing because of the situation we were in. So now we're looking at every component of the program is going to be done. So in fourth quarter, I'll talk secondary right now. In fourth quarter, we only made students do quizzes and tests. In this, they will be doing the whole program. The instructional part is important. We were hoping students would do the instructional part so that they would do well on the quizzes and tests, but some didn't. Some went straight to quizzes and tests, and some were very capable of doing that. But the whole program will be part of it. So that's important to know. The easy transition back and forth because of the alignment is also important to know. Wraparound services. So I want everybody to understand ESE, ELLs, 504s, those things. So those are all having to be reviewed as a student. So these are all the things that our APs and our guidance counselors are trying to work through to make this transition smooth. But those students still, if the accommodation is appropriate in the online environment, will still receive that accommodation. Our ESE students who are VE students will have a specific VE teacher, and that will be a face-to-face. We've purchased a program called USL that also is an academic program for our VE students, but they'll have a lot of interaction with their classroom teacher in that platform because that's what's needed in there. If a student is speech, that student, or OT or PT, that student has the ability to come up to school, to the brick and mortar for those services if they choose to. So that's something that every phone call they're having to work through. However, if they are not comfortable with that, that will be provided online. Mental health services, same thing, that will be provided online. So all those pieces are still available both in brick and mortar and online, okay? In the online program, there is one of the requirements of teachers will be weekly progress reports to parents. So the program itself creates it. It's an easy email to parents. However, parents can get on the program 24/7 and see the progress of their students. So that does help for parents to know how their students are progressing in that program. So I want to talk about elementary a little bit. So what we did is our working group. We sat down and we looked at what does an online teacher really need to look like in this environment? What do we need to do? What did we learn from fourth quarter that would help us make it better? And so that's what we worked on. So in elementary, the teacher will be still under the supervision of their principal. So they'll still be a Shalimar Elementary teacher, if that's where they were. They'll attend training, there are 3 days of training, and so on. As a teacher, they'll create a syllabus that will keep pace for the student. So in other words, you need to be here by this time. During the first week, they will have 5 days to make email contact. And the reason why we did that is it's the number of students that they may have. So just gathering the information, being able to get that information out. And within the first day, first 10 days, they will make a phone call contact with a student and parent. So that's very important. So they'll have that connection. Teachers will have office hours from 8 a.m. to 8 p.m. So somewhere within that time, so not the whole time. They'll choose their 6 hours. We did that purposefully because what we learned in fourth quarter was that there were parents who were working, especially in elementary, and their children were staying with grandparents who didn't have the technology ability to help them. So we found that sometimes 5 to 8 was a much better time for parents to get on a Zoom or help their students or get questions answered from a teacher. So the teachers will determine. They may say, I'm going to have office hours from 8 to 11 in the morning and then from 5 to 8 at night. And that's perfectly fine. So that's going to be their option. Once they really know who their students are and what those students' needs are, they will be able to then maybe adjust that. Teachers will always be available by email And if they use Remind or Google Classroom or many other platforms that teachers currently use. In elementary, because we purchased iReady for everyone, that is for everyone. It's not just for the brick and mortar. So that's very important for people to understand. So iReady will be their progress monitoring tool that students will have to do. That hour, so we built in an hour a day in ELA and an hour a day in math in elementary for a teacher to have instructional time with the student. So that they have their platform that the student can work at their own pace, but now during that hour of instructional time, the teacher will be able to do those iReady lessons. So it might be Monday, I take 5 of my kids and I have a face-to-face with them during that hour, or I take 2 groups of 5 at 30 minutes and 30 minutes and do my face-to-face with those students, while the other students are working on their iReady side of the program, because that's also a computerized program that they work on. So the student might not meet with that teacher every single day, but they have the ability to. Then the teacher will also have a 60-minute a week open Zoom. They'll just have their computer open, it'll be Zoom, and if any child or parent has a question, they'll be able to go in and ask the question at that time. Now remember, teachers are available, it's almost like, and it's almost like they're available 24 hours a day because they can be emailed. Now the answer is, though, that teacher has 24 hours to respond to the email. So if the teacher has a student who says, I'm struggling so much with this concept, then that teacher can open a Zoom just for that student and they work through a concept together during their 6 hours of office hours, okay? So I think those things are all extremely important to understand. That's a big difference from what we had fourth quarter. A lot more interaction with students, a lot more instructional time with students than we've had in the past. So that's elementary. They also will be sending, teacher will send a minimum of 2 emails to students each week, 1 personalized email and 1 progress report. And then they will also be checking the program progress twice a day to make sure that children are progressing in the actual program as well. Okay, so that's elementary. Do you guys have any questions on elementary?
I have one.
Oh, go ahead. No,
I've
go
got
ahead.
one general question. You know.
Sure.
You made a comment about how many students the online may have. Do I take it that the class size amendments that we've lived under for quite a while now don't apply online?
So this was a big piece during our work group, and the work group, and remember I said that the union was very prevalent in the work group. They were all part of it. We worked through some things, and the teachers were very much wanting to make sure that the number of students teachers had online were equivalent to what they had, plus the duties that a brick and mortar teacher has to have. So there was a lot of discussion about that. So let me say K through 3, if you are departmentalized. So when I say that, I mean there's a teacher that does ELA and social studies and a teacher that does science and math, okay? In a brick and mortar, there's usually 18 and 18, and then they swap, so that teacher has 36, okay, kids, potentially, in a day. That's in brick and mortar. In the online, the K3 in that situation is 40 plus or minus 10%. So it's not a big difference. But that was also to work through some of those issues that the teachers that were on the committee and the union wanted to make sure that everybody had an equal playing field in school and out of school. In a self-contained classroom, traditionally in K through 3, we have 18. In the online, it's 20 plus or minus 10%. Because you're not doing direct instruction in every period, every day in the situation that we have. So it's a little bit different. So that's why there's a little bit, a few students more.
And the unions bought in on? I mean, 40 plus 4%.
Yes, sir.
is
They were,
44.
they helped me come up.
Okay.
Sheila did not do this on her own, trust me.
And you made them happy. Congratulations.
Yeah, yeah.
As happy as they can be.
Let me say this, I have to say this, and I hope that they're listening. I'm sure that they are. We have worked, the union has been phenomenal. We have worked hand in hand, and we could not have accomplished all the things that we've accomplished without that. They have been really outstanding, and we're taking their input, they're listening to our input, and it's been a great working relationship. So I want to say that up front. It has been a big deal.
Very good.
I don't think that's true around the state. So I'm very grateful for that relationship.
I just have one comment, and it's probably unanswerable to this point, but one of the concerns I have in any venue, whether we're face-to-face, at a distance, or some blend, is those families who have ESE students and or advanced students, and some families who have both.
Mm-hmm.
They might have an ESE and an advanced. Will we get to the point where we feel like we are doing justice for both ends of that spectrum in an environment we are now? I know that's a totally difficult situation.
No, I think it's a great question, and in elementary, I think that's what we're doing, and that's why we chose the iReady curriculum, because the iReady curriculum, once a student takes the assessment, and then they do assessments kind of all along, it will group students based on their need. So as a teacher, whether I'm online or in the classroom, I'll be able to work with a group of struggling students who have a similar need, and my high flyers, and it gives me the curriculum to work with them on. So I absolutely believe that is we are headed in that direction. Is anything perfect? No, but I think we are making real good strides in that direction.
And for the accelerated students, we are.
So again, my accelerated students in that situation, in an elementary situation, they are grouped together as well, and iReady gives us the curriculum that helps accelerate them. It gives us the curriculum for our struggling students. It's all individualized or grouped for us. Does that make sense? Mm-hmm. So hopefully that will help fill those needs. And that's why that hour of instruction in elementary is so important. Now, I will tell you, I've had parents who said, what if I can't get on? And you know, we'll do the best we can. That's why the teacher's still available through email and all of those things, because that is a struggle for folks. And we knew that. We saw that in fourth quarter. We knew. You know, folks that are trying to go synchronous, which we're going to do with some, but to do that with all will be, I'm interested to see how that works out, because many of our people were unable to get on during certain times. That's why we're trying to have open Zooms. We're trying to have the flexibility of 8 to 8. So there's lots of pieces to give folks flexibility to meet their lifestyles right now, because everybody's lifestyles kind of turned upside down. So.
And I would just comment on iReady. I know several schools in the Crestview area are already on it completely.
Yes.
You got a couple, so I think with the program already being out there, I think the transition for a lot of these students is going to be, because they're already
very
using
easy.
it.
Mm-hmm.
So.
And all of our second grade was currently using
Right.
it. So that's not new to
Right.
anybody
But
who's been in second grade has
Right.
been in it. Yes.
But I know in Crestview, I know Northwood and Riverside, I believe, are completely
Our full schools, yes, sir.
completely on
And
it, so.
Florosa has been, Miss Massey, she was jumping for joy when we went to this.
Right.
So in that, I also want to say one of the other things that we did, because this is a computerized program and then a face-to-face program, the components are so important with that face-to-face part. But when the other students aren't face-to-face with the teacher, they need to be on the program.
Right.
So that's one of the things that we did in our CARES Act is we're trying to get one-to-one, either iPads or Chromebooks in K3 and 4-5. So that way, when our students are in that need, are doing iReady, they have exactly what they need and they go forward in it. And we're not worried about getting a cow or a cart down to a room. So that was a big deal for us to make the gap of this education work better.
And I believe the numbers reflected over the years that we've used iReady, how students improving.
Absolutely,
So
yes.
it's
yes.
exciting that.
And I'm a big proponent of that instructional piece. It's not just the computer
Right.
program. It is the instructional piece that comes with it.
Correct.
That guides the teacher as to the exact needs of the student. So it's
Correct.
it's like, I'm chemistry, right? So I go back to, it's just like being in the doctor's office and I get a test back that says, I don't want a broad spectrum antibiotic. I want an antibiotic that attacks what's wrong with me, right? So that's what iReady helps us do. Whether it's what's wrong with me or what will enhance me, it gives us that.
Correct.
So, okay. All right. So secondary, let's go to secondary a little bit. So we already talked about block scheduling, so we've done that to reduce that time. In the secondary component, we are looking at, we have some very special situations. Like Mr. Chambers said, we have IB. And I'm a former IB teacher, and so I know that you have to finish that program. Both of my children graduated with an IB diploma, so I get that.
Ms. Lightbourne, real quick for the public, could
Yes.
you just tell them what IB is?
Certainly.
Yes, sir.
IB is an International Baccalaureate program. It is unique to Choctaw at this time. Back in the day when we started and I was teaching, it was both at Choctaw and Niceville. It is similar to AP, but it's a full program where students have to take all of their courses, their college level courses. At the end of each course, they take an assessment. If they score a certain score on that assessment, colleges will give them college credit for it.
Okay.
And then they also will, if they get an overall score with lots of different components, all of those 7 tests that they take plus some other components, they can also receive what's known as an IB diploma, which is an international diploma, as well as their high school diploma. So that's a quick and down and dirty
That's
on
fine.
IB.
That's fine. When we start using abbreviations, some people
I
are like,
understand.
what-
No,
what-
that's great. That's great. So IB is a need because you can't not do it your senior year if you've been doing it this whole time. That's the big year. That's the big, you have 5 tests. That's what's going to get you your college credit. So that's one of the things I worked with Ms. Heck on. She's called in her teachers. They're working on how can we do this synchronously. And so that's one of the ones that we're looking at, absolutely zooming into the classroom and doing it. Now, some of the teachers said, well, I might want to Zoom with those kids individually kind of during my planning period or my duty period, so we're working through those pieces with them, but that is something that we are going to do synchronously. Another program that came to light in all of this as people were putting their course requests in was ROTC, which I wouldn't have thought of. So ROTC, apparently if you don't have it for 3 years straight, you're not eligible for some of the scholarships that are available. So we're currently working with the ROTC folks, and they're checking with their military connections to make sure that it's okay to do that synchronous learning with those students as well. So that's where we are with that. So we're working on that. I've had many Zooms, and Lisa Tucker's been phenomenal with our band and our chorus. And band seems to be one of the big requests. I can't come to school, but I really still want to be in band. So our band directors are willing to try some synchronous instruction as well. So that's the route we're going. We're looking at how can that happen? How does that happen? Like, where are you going to put it so that the flutes all sound right? I'm not sure. So that they've got to figure that out. But we are working in that direction as well. Some of the AP courses, as I said, AP Chem, AP Physics, we'll work with those individual situations, but that's a difficult situation if the student can't come in and complete the lab. That's a requirement of College Board. So sometimes we're just going to have to make choices, and I know they're not easy, I understand that, but some things are just not going to be available in an online environment. Or, can you be synchronous in the classroom most of the time, but when there's a lab, are you willing to come in for the lab? That may be a way that we can do it. So that's one of the things we're working on. Biomed at Fort Walton Beach is another one that we're working on. But again, lots of hands-on laboratory experience there, so not sure how well that's going to work. We're talking with the teachers right now to get that going. Okay, so those are the pieces, big pieces in secondary. There's a little bit difference in secondary because we looked at that 1 hour of instruction, like we said for elementary. So 1 hour instruction in elementary is 1 hour of ELA, 1 hour of math. That's doable. Well, when you look at, you're in a platform for secondary that requires a significant amount of time. You can't do 1 hour of instruction in every content area as well, because you'd be in content area for 6 hours or 7 hours if you have 7 courses plus the platform. So that we couldn't do the same thing. So what we did is we kind of flipped the situation. So in secondary, the teacher will have an open Zoom daily for 1 hour a day. So each subject will have their Zoom open daily for an hour a day. Any student can come in and ask a question during that time and go right out. They don't have to stay in for an hour. They could go in, ask questions, get help, come out. They will do 1 hour of instruction a week. So that more means if I'm a science teacher, I might do a virtual lab that a student can see if it's not something like AP Chem. But so that students can see it and then continue on. It might be that I'm learning how to do a reading, a specific reading concept or a specific writing concept. So, or a very, very difficult math concept. So there'll be an hour of instruction a week in the content areas in high school. So we had to do that differently. It couldn't work the same way. And as far as class size, those students it's 160 plus or minus 10% on the high school side. So that's what we're looking at when we're trying to put things together is, do we have 160 algebra students and an algebra teacher at Niceville High School? And if we do, then that's going to work out perfectly. If we don't, then we have to look at how do we pair some schools together. Okay? Okay. So I already talked to you, I came up before. I wanted to make sure that everybody understood that parents have multiple options. I had an AP tell me, she said, I told the parents, have it your way, just like Burger King. So I thought that was kind of interesting because we are offering, you can come to school. You can come to school for one period. You can take online through my school. You can take online through Okaloosa School. You can take online through Florida Virtual School, and we can mix and match. So we're trying to be as flexible and meet as many needs as possible. And we know we're not going to meet every need. It's just not humanly possible, but we're trying to meet as many needs as possible.
I have a question for you, Ms. Lightbourne, and this, you used the word synchronized quite a bit in there. So I've gotten some emails from parents regarding Escambia County and their offers that they have. So you're saying synchronized. Is this kind of leading up to the offer that Escambia County has where they were talking about having?
For these special programs.
Right.
I mean, I just want people to think about this. So I was an elementary principal as well, and Dr. Kelly, you can definitely understand this. If I had 15 kindergarten students in my class and then 5 online, and that was synchronized, I'm not quite sure how effective that would be. Right. So those are some of the things that we thought through this process. Sure, it might work with IB, and that's what we're working on. It will work with those things that we can't do this other way, that we have made those crosswalks, we have made our pacing guides work, we'll have easy transition in and out of buildings, and if we have to come out, then a teacher doesn't need to be all by themselves, relying on their own to come up with curriculum. We have an established curriculum that is state of Florida approved. So, yes.
I do have a couple of questions. Is that okay?
Go ahead.
Okay.
Dr. Kelly.
So I appreciate that. Thank you. Were there any considerations or conversations around post-secondary?
As far as like OTC?
Yes.
I think that, I don't want to speak beyond my knowledge, but I do know that there are lots of conversations going on with that. Kelly Hayes is leading that, of course, as her building. It's unique to her. My task was to work with K-12 and get K-12, which was a pretty hefty,
Hefty,
and
then.
ESE.
heavy
So, but I
lift.
know that that is being worked on. I think there are some, the state has given some leeway as far as clock hours in some of the things. I've also heard that there are some, there's some leeway with internship times and things like that. But I would have to really defer to Kelly Hayes because I believe that she would have that knowledge
So
intimately.
they were not part of this work group because they were not.
Yeah, I think they're in really, all of theirs is so hands-on and has such different requirements than what K-12 has that they had to have their own work group.
And a second question, this may be for the superintendent, but whoever has this responsibility. If someone really wanted to participate as a part of a work group, how would they go about getting to sit on a work group? If they were not, if their voice wasn't heard, how could they participate in
So-
a work group?
So one, so Ms. Lightborn can talk about the work group in terms of how that was created, but then we went above also where we had the elementary meeting, where I think we had 250 elementary teachers who signed in, so that was wonderful to see that many of them chime in. And then also the secondary level, I think we had about 150 secondary folks, not just teachers, also ed support as well. And of course, then additionally, our principals doing a good job communicating with their staff as well.
But for someone who wasn't on anyone going forward, if they wanted to have input or be part of a group, how would they have that information? Is it going to be on our website or somewhere?
And when you say going forward with an additional work group, what do you mean?
So like, I don't know if you have this in mind, but I know if I were creating this animal and looking at this, like we used when we were in curriculum previously, we would say often we're creating the plane as we're flying it, so to speak. So are we having anything going forward like a take my pulse, a recongregation where we say, how's this going? Maybe we need to adjust here, or this is going well, but this segment isn't. Are we planning for anything like that? It would seem like that would be fortuitous.
So what I believe you're getting to is once the school year starts and we're taking a pulse. So Ms. Lightborn, part of the progress monitoring piece of this, even with the state, is the progress monitor. So Ms. Lightborn will be progress monitoring where we are throughout this process, and you could probably speak a little bit more to that.
Well, yeah, we'll be using iReady as our progress monitoring tool. That will be something we'll have to turn in quarterly. So we'll have that side of it. I think what you're asking is, can other people join? So I think what we all have to understand is when you have a work group, you can't have 250 people on a work group. So the union actually selected the teachers that were on the work group. At one point, when we really got down to the down and dirty, I asked them to get more teachers, and they did. So there were more teachers involved in that. And then, like Mr. Chambers said, we opened it up for input to other people. But when you're in a work group, I think we had about 20 some odd people in the work group. I'm not sure that it could be opened up much larger than that. However, I think we've done surveys. I think we'll continue to do surveys. That will take the pulse of our teachers. How is this working? There will have to be lots of communication with our online teachers and our online students. How is this working? What things do you need from us? Those things will still occur.
And I appreciate all of that. I guess what I'm really trying to get to is maybe if the list of who's on the work group was public and anybody in the public who wanted to connect with one of them and say, here's a concern or here's an idea. So just so that we have all open avenues of people to give input. Does that make sense?
It does? Yes, ma'am.
Okay. Were there any other questions on?
I'm going to ask Ms. Ivanchek, do you have a question?
Yes. Hi, Ms. Lightborn. My question is kind of going to move over towards the calendar, but it's about the academic calendar. Since Dr. Kelly brought up the post-secondary and with OTC, now we approved earlier in the summer that they could go ahead and have students on campus because of their unique situation and that the students are adults. So when we look at a calendar, and if this board decides to change that calendar, it will not affect them, correct?
That's probably.
So we'd have to look into that.
at different times, and so they're already doing different programs. So I would think that they would be exempt from any change if we decide to make.
Well, and Ms. Ivanchuk, I know currently they have instructional days when we don't during some of the vacation times because of the clock hours that they have to do. So I'm sure that we'll be able to work through that situation with them.
Okay, thank you.
Any other questions, Ms. Ivanchuk?
No, thank you.
Okay. Dr. White, any questions or comments for Ms. Lightbourne?
No, sir. Very thorough. Thank you, Ms. Lightbourne.
You're welcome.
All right. Mr. Chambers?
All right. So at this time, Mr. Mitchell, so the virtual education, so as you know, we have to really look into many facets to make sure that we can do this well. But one, from the classroom teacher, what do we need to take into account to do the virtual education in terms of making sure that we can hear all those type of pieces are good, as well as do we have the ability to do the virtual education across all classes, across all teachers?
So, if you think about some of the things that hinder us in technology, for this district, it's never been a hindrance, but we've had bandwidth. Bandwidth is one of those things we have to have a lot of. It's like I like to explain it to folks. You got a drinking straw, that's your bandwidth. What you can get through the straw depends on the size of the straw. So currently our straw is the right size for the district if we were doing normal standard education. When we change education, those straw has to change to match with it. Exactly how big it needs to be is an estimation at best. And so one of the things we'll be moving forward with is a multiplication of bandwidths for most sites by a factor of 5 or more, depending on the site. We'll be doing some things, for example, there are several schools where the two schools share the same internet connection because they were so close in proximity. It was easier for us to run a line from one school to the other to share than it was to connect to two separate sites. Those will be sites where we won't be able to share anymore. We'll have to put them on because in order to do virtual from within the school, we have to have concurrent video sessions, and in order to be able to do those, we have to have the bandwidth in place. Now the good news is that we believe we can have the bandwidth in place by the start of school. And so that part is moving forward. If there would be any handicaps from a bandwidth perspective after the start, it's going to be at the very end of the line, and those are scenarios that we have been working on to have a solution for. We think we can solve those fairly quickly and get those addressed in a quick amount of time. Now, as I appreciate very much your apologies on my behalf for how this meeting began and the meeting previous because of technical issues. Maybe that at this point in time also gives you kind of an idea of what we could possibly see in every single classroom. Now, to be fair, in the classroom, I only need one computer on the internet. Here, I needed a bunch, and that's why we had an issue. I don't expect the same kind of scenarios that you saw here to be the same that we have in the classroom. But there are some issues. So if I'm a teacher, for example, I've never done this before, especially if I'm sharing my classroom with another set of kids online. If I have some in the room and some on the line. I've never done that before. And so there's some training that has to go with that. There's new equipment that has to go with that, microphones that capture the room. You saw earlier I had the snowball that was up here, the green, it's a green, but it's a snowball. Those are microphones, not necessarily that one. We would actually want one a little more better designed for picking up room ambience, but that's kind of what we're talking about here. All of those pieces have to be put into place. But for that virtual piece to happen, for us to have another great example, the bandwidth that you use at a school. So let's just say I don't have a classroom full of kids, I'm just the teacher, and I am based out of the school teaching 120, 150 kids online. Okay? Those are going to be in separate periods. So maybe I have 20, 30, 40, I don't know how many I might actually have online at a given point in time. Well, the bandwidth doesn't just go from you out, it goes both ways. So that person's got to have a lot of bandwidth to be able to do that, to be able to have all those videos coming in and all those messages going out. It's not as simple as just one person being able to do that. And so there's a lot of bandwidth that we have to deal with in that. I believe that we currently have enough room with the gear that we've been able to do from E-Rate and some other pieces to at least get us a bandwidth and our internet to be able to be at a place where we can do this. As far as the hardware goes, from a technology speaking aspect, from the teachers already have the laptops that can handle the process. The students in the classrooms, there's not a lot of reason for gear there, but we have devices. Elementary, I think, is going to be covered well. When we get about the folks who are going to stay at home, the students are going to be staying at home. We've told them how we're going to deploy those devices to them to assist with them, and that's going to be a goal we've done before, and we'll just do again. I don't expect that to be an issue. We're still going to have the same issues that we had earlier with the folks who live in areas where there's no internet. And by that I mean there's about 3 communities in particular where we know that even if I call a company like CenturyLink on the phone or somebody else and say, I need this person to have internet, that it's just not going to happen. And even if it did, it wouldn't be an internet that would be capable of handling what we're trying to do. And we just know that those are going to be things. We have to keep pushing forward to make those areas work for them. And those are things that we're always working on. We're not, just because we can't do it today doesn't mean I can't do it tomorrow. And we're pushing our vendors and we're pushing our folks to find solutions for those areas. What am I missing for the question?
So
far?
if we have 100 teachers at a school, do we have the ability for all 100 teachers to Zoom virtually?
After we do the bandwidth increase, I would say that the answer is probably yes. Until we actually do it, like we had an actual meeting today, till we actually do it, I can't guarantee a 100% on that, not at all. Because we're told by the company, you need bandwidth and this is how much. But when you actually get in there and you actually do it, all of a sudden numbers change, things become different. But right now I'm going to say that once we do our bandwidth increases, we should be able to handle each teacher doing a stream from the school with their devices. I don't foresee that to be an issue at this point.
Have you had an opportunity to look at the other districts who are doing virtual synchronized instruction, and if you have, what have you noticed?
Well, we can talk about that from twofold. First off, I went in and looked at all the neighboring counties and what they were planning to do. And their definition of synchronous is a lot like our definition of synchronous was for the last session. It wasn't the idea that I'm with a teacher 24/7, but however long the school day is, with my student watching that classroom the whole time. It wasn't like that. Their idea was basically what we were always prepared to be able to do, which was to say, okay, I'm a teacher, this is the lesson, I can show the lesson, they can go do the lesson, they can check back in with me, but there was never an idea that I had to be with that teacher on a video 24/7, or the length of the school day, I should say. So, but all of our neighboring counties are all working in those same directions.
So I think that kind of answers what I've been hearing is, there's people who out there who think they're under the assumption that you can actually do that, that your child will be in front of that computer from first period all the way through 7th period, or through the whole day, and there's going to be a teacher there being able to teach a class and that student online. So you're saying that those neighboring counties, even though that's not happening,
No, when I discussed that with most of the neighboring districts, when I talked to their IT people, it was pretty much the same discussion that we're talking about now. Okay. I'm going to have, teachers are going to be able to meet with students, they're going to be able to talk with students, they're going to be able to instruct students. But this idea that like, especially at the elementary level where I'm just watching a classroom all day long, that's not what they ever had intended for this.
Right.
Let me take it one step further. I've been working with Tallahassee on the E-Rate program. Now, we get paid back for bandwidth. Bandwidth is a federally funded program. Through talking with them, we've been discussing the need that other districts are doing the exact same thing we are. They need more bandwidth. So we see, I'm getting reports that lots of other districts are having to do the same bandwidth increases we're doing. And I'm actually going to meet with them Monday, and we're going to make a plea with the federal government, and hopefully we can either reopen the E-rate window or get us another way to ensure that we can receive federal funding from a different set of funds to be able to help us with the bandwidth increase.
So could I ask a question?
Go ahead, Dr. Kevin.
I think this might be a clarifying question. So when a district, for example, Escambia, and Eric and I have already had this discussion, so really asking for the viewing public, when they say they are offering their parents that third option of a synchronous, real-time, same time, in the classroom but online option, what are they really describing? It's not what the visual that comes to mind. What are they actually defining that to be?
Their description from my discussions wasn't dissimilar from what we're discussing now. That they had their idea of a synchronous discussion was pretty much the same thing that you have. In previous models, we basically said online, do it when you can have it during your day when you decide you want to do it. Under these models, they were saying, okay, school day starts for 8 for everybody. So, if you're a first grade student and your school day starts at 8, then we expect you to check in with the teacher at 8 o'clock.
Right.
But the idea that that student was going to stay on that entire time was not what they were envisioning. They were envisioning being able to say to the student, we're going to do math at this time. We're going to do different things at different times. There was not an intent, for example, for a student to eat lunch and have other kids watching them eat lunch from the other side. There was never any kind of breaks or anything like that. There was always the intent of go and then come back.
So
So
more
if
like
it's a
an open
50-minute
Zoom.
So if it's a 50-minute class period, what you're saying is, as you've researched other areas, the student's not staying on there for 50 minutes, then go to the next class 50 minutes, go to the next class 50 minutes, or they're staying synchronously for 50 minutes in each class throughout the day.
That's correct. We've seen that in several models that we've looked at, that's the model they intend to do. And talking in other directions, I mean, we've talked to several districts or looked at a lot of other districts' plans, even Orange, well, not Orange, excuse me, Miami-Dade, some of them others, pretty much the same kind of model. We're going to have your ability to be meeting with those folks, that they're going to be able to have class at the same time. So the idea that it's creating a, I'm trying to think of the way to word this, it's creating a forced schedule upon the student. In other words, I don't have the, like a traditional online program, I would have the ability to, just do my class when I felt like doing it. I may not work for 2 weeks and then do 2 weeks of work in 2 days, trying to, not sleep for 3 days, that kind of thing. That's not the way they're talking here. What they're talking about here is, okay, you've got to check in every single day, plain and simple, and you've got to do it at certain times.
Okay. Dr. Kevin?
So, thank you.
Mr. Destin?
I don't have any other questions.
Okay. Ms. Ivanchek, any questions for Mr. Mitchell?
No, thank you.
Okay. Dr. White?
No.
Okay. And so at this time, we're going to recess for just about 5 minutes. We do have we do need to take a break, but we're going to recess for 5 minutes, and then we'll call the meeting back to order. So we're recessed. Meeting back to order, and Mr. Chambers.
All right. The last thing that, and first of all, I appreciate everyone's time. I know this is long, but there's a lot in this reopening plan. The last thing I want to discuss, just this piece will be sports. I think, as you know, we have a phased approach on our sports, and right now we are currently in phase 1.5. Okay, 1.5, and the actual start date for football, for example, and some of the other sports is July 27th. All right. Surrounding districts are all right now saying, how are we going to do sports? So, of course, our district as well as our surrounding districts have delayed the reopening of schools. So I've reached out to our surrounding superintendents we're hoping on this Monday. We're going to get the superintendents either in a room with social distancing or on Zoom, and we're going to talk about sports. So right now the FHSAA did not delay the start of sports, but we have to decide as a group of our surrounding districts, because we play each other, when would be a good opportunity to start sports. So for example, it could be that we replace August 10th with July 27th. So July 27th is when it should start. We might delay it to August 10th, and then the first games starting in September. However, obviously we got to be very mindful of games. Now, I played sports in high school, played sports in college, absolutely love sports. We all want sports to start right away. We got to be on the same page with our surrounding districts and start safely. You look at college football, a multi-billion-dollar organization, so they haven't established exactly what college football is going to look like yet. The NFL, a multi-billion-dollar organization, they're still working through some of the pieces of their restart. So we have to be mindful of where we are in our area, but we have to be able to work together with our surrounding districts to plan for a restart. But I will say there's some superintendents in our area and across the state that before we play, we need to make sure that we're in an environment where it's safe to do so. Then the question comes up about fans. That'll be one of the things that we'll be discussing as well. As you know, Major League Baseball starts today. I can't wait till 6 o'clock the Yankees play. I'm excited about that, but there will not be fans in the stadium. NBA starting, there will not be fans in the stadium. Now, I think the NFL and some others are potentially could be taking a different approach, but we'll see. We know in high school, without fans, there's no revenue. Without revenue, there's not necessarily the ability to run our programs the way that we would like to run them. And then, of course, Rita starts twitching on the finance side. So there's a lot to still be discussed. Our coaches have done a fantastic job during this phased approach. We've been in contact with our athletic directors at the high school level to make sure that we're together. And I know a lot of them want answers, just like everyone wants answers because they're eager to get started safely. But we've really met with them. Brian Humphreys has done a great job meeting with our athletic directors. Ms. Lightbourne is becoming more and more knowledgeable in sports by the day and doing an absolutely great job as well. But hopefully this Monday, we'll be together and we'll have some good conversations, and then we'll be able to report back to you in terms of where we are at that time.
And for me, I had a question that was brought to me the other night. Somebody had sent me a question. Is it going to be up to the school district on whether we move forward with sports? Is it school district specific? Because, as you know, Crestview and Niceville play schools in Tallahassee. And, of course, Leon County's been a little bit more, aggressive on how they're approaching sports and all that, and so that would affect some of our teams over here. So their question is that going to be district specific?
So I'm going to answer that hypothetically, but hypothetically, definitely district specific. So the FHSAA, and make sure I don't say this incorrectly, Ms. Lightbourne, the FHSAA has left it to local districts to make the decisions on sports. Now, I know a number of the coaches, athletic directors, they're a close-knit group. They've already been talking. Do they create their own conference, so to speak? Do they create? So those are some of the conversations that's happening. I think right now the FHSAA has established when playoffs are. So districts have the ability, if it was a 12-game season and they want to push back, they could push back a week, 2 weeks, 3 weeks, 4 weeks, but then that's just a less game going forward. So it's left to the local districts to make decisions.
Okay, all right.
And Ms. Lightbourne wants to clarify one thing or add.
Okay.
So just saying, I am a soccer mama. So, however, I did want you guys to know that, as Mr. Chambers said, that our local districts are all talking right now about how we can make this work. The Florida High School Association has asked the districts to make a decision as to whether or not they will play in the state playoffs. The ADs in the local districts and the superintendents will be getting together and talk through that. Or what some of the ADs have talked about is, do we make our own playoffs out of ours? Because if a lot of school districts don't play, our first round of playoffs could be in Miami or in Tampa or wherever. And then do we really want our students traveling to those areas? So there's lots of concerns and lots of things to be thought about. So those are some of the things that they're thinking about. And within the bullets that they're working through, they're also working through not only fans, but band, cheerleaders. Do they go to away games? Do they just stay home? And so we want all of the districts are trying to be together on it and have the same, in our area, have the same outcomes.
So I know that you all have received questions, emails, just like myself. So just wanted to really go through this today, be very thorough. I think it'll help you all as well as you communicate with families or employees. So this might be the longest workshop we've ever had, but wanted to give you all information as well as giving the public information.
Okay. All right. Any, Dr. Kelly, anything that you would like?
I would just reiterate what I asked at the last workshop, I believe it was, that when we start talking about masks, first of all, I think we need to be very clear and not just have a nebulous, well, I'm not going to give a directive. I think I've spoken with you privately and mentioned that, and I said publicly, I like what one of our neighboring districts is doing with masks, in that they're requiring students to keep a mask on their person at all time, and regarding a mask, much like any other required school supply. We require our students to have any number of items for school supplies, and then in areas where we cannot social distance, like the bus and the hallway, they are required to wear their mask. And then in the classroom, I would like us to consider giving that latitude to the teacher. I want our teachers to feel empowered to say, maybe I'm medically fragile as a teacher and I would like you to wear your mask in my class. Or maybe they feel comfortable, particularly if they're secondary, saying, for instance, when I taught language arts, I'm quite comfortable teaching here from the front of the room, and you students are 8 or 10 feet away from me. Don't wear a mask in here, I'm fine with that. So I would like to see us consider giving our teachers some control over what happens in their classroom.
Yeah, thank you.
Mr. Destin?
Nope.
Okay. Dr. White?
No, Chairman Bryan, I'm
Okay.
good, thank you.
Thank you. Ms. Ivanchek?
Yes, thank you. Back on the sports, when we're talking about the football and that each district will make that decision, will we also be making a decision about the spectator piece, or just whether or not the students will play?
It's a good question. So we will be talking about spectators at that meeting, but we'll also be talking about spectators with Dr. Chapman as well. So the spectators will be a big conversation, and whether we're able to go through with that. And like we said, we know how athletics are funded, but safety's got to be first and foremost. But that'll be part of the discussion with the superintendents as well as athletic directors and coaches in the area.
Plus, you have for football, of course, you have bands and halftime, and a lot of times, that's how they're funded because a lot of schools they do the program and those kinds of things. So we'd have to look at that aspect as well.
Well, I think that's already been determined that the bands will, was that the recommendation of the FHSAA that the bands not be participating in the games?
What was the answer to that?
Ms. Lightboard's going to clarify, make sure I didn't misspoke.
There were recommendations from the Florida Medical High School Association, Athletic Association to the Florida High School Association.
Right.
That I think recommended that, but Florida High School Association did not take a stand on that.
Okay. I thought I read it where they were. I know about that medical board you're talking
Right.
about too, and I know they're meeting again tonight, I believe it is, so if I'm not mistaken, so.
But I would add to Ms. Abanchek's question, we are and have
Yes.
been working with our band instructors. So I know that's one of the pieces that we'll be talking about. If we were playing, do they go to away games? Do they not? So they'll be a part of that discussion. And then what does a halftime show look like?
Right.
So, some of our bands are 200, some of them are 400. What does it look like? Do they go to smaller pep bands, for example, and then rotate? So there's a number of different models that are being discussed, but our band directors will be a part of that every step of the way.
Okay, thank you. One more thing. I know that Mr. Destin brought up something about class size. I just want to verify that because I've had a lot of questions about brick and mortar class size. So will we still be following the current guidelines? For example, in a high school, there's so many students in a class, right?
Yes, ma'am. This board has always held to the fact that we'll meet the class size amendment at the school average level. And as you know, that's 25 at high school. And so there could be some classes with more, some classes with less. As we have all the students move, those students who move to My School Online and don't come into the building, that is fewer students in the building, but we wouldn't be able to keep the same number of teachers in the building and spread those students out because we'd have an added cost of more teachers. And so we'll likely have some empty spaces inside buildings to do some creative things in terms of spreading students out, but I wouldn't expect to see class sizes significantly lessening in schools to half or anything like that. So I don't know which way you were wanting to go with that question, but we'll still meet class size. Yes, ma'am.
Okay, so I think they're concerned with that they might have more students because other teachers would go online, but you're saying chances are it would go the other way.
Well, and I wouldn't guarantee that,
fewer.
but when Ms. Lightbourne mentioned with the curriculum group, the number of students that they're talking about the online teacher taking is, I think the number was 160 plus 10%. So that's a number that's typically as high or higher than what you would see in a classroom. That speaks back to kind of that equity of duty piece. So I would not expect to see numbers grow in the school building. That's not the direction we would want to go.
And Mr. Horton, because this has been a question that we all get as well. So some have asked us, why don't we just have classes of 10 or classes of 8 or classes of 12? What would it take to do that?
Well, to cut the class sizes in half, you'd have to double the instructional staff. And so that's the simple math behind it. And that's with the assumption that we're bringing students to school 5 days a week. And so, the only way to do that would be to not bring kids back to school 5 days a week, which is what the commissioner's emergency order said that we would do, is bring students back 5 days a week.
And how would that impact classroom space?
Yeah, so if you cut all the class sizes in half, you would double the requirement or the need for classroom space, which we don't have in any of our schools.
Okay.
Thank you.
All right. All right, so we'll move down to 10.2, any items that will be moved from consent agenda, if there is any. So now we're down to section 11, construction programs, owners, representative, business. Mr. Destin.
Well, Chairman, things are exactly the same as they were at the last meeting. I had the agenda sent to you. We're going forward with all of those projects, and of course, we are still exploring our issues at the high school stadium in Crestview, which we anticipate are all going to be addressed in a timely fashion.
And I will say, I know Mr. Chambers and myself were at the graduation Friday night, and appreciate the black.
Got the right color?
Yeah, it was the right color, so. All right, so we'll move down to section 12, information technology seat management. And both of these items will be voting items. So 12.1, IT seat management outsourcing agreement, contract modification agreement, change order number 14 between the School Board of Okaloosa County and CACI NSS Incorporated. And 12.2, IT seat management outsourcing agreement, contract modification agreement, change order number 15 between the School Board of Okaloosa County and CACI NSS Incorporated. And that moves us down to Mr. McInnes's business.
Just one item, Mr. Chairman. This is just a renewal of the representation agreement you've had for a number of years with Julie Weatherly in resolutions and special education. And so that's what will be before you Monday night. No change in the rate. We are changing the language just to make it a renewal on a continuing basis so that either party can terminate if they need to do that, but then we won't have to try to keep up with the specific annual renewal or term.
Okay. 13.2, consideration of recommendations, updates, requests, and pending legal matters.
No other reports there.
Okay. And Mr. Chambers.
I think we've said enough today, but a lot of information, but I appreciate the time.
Yeah. And we'll start with school board members' announcements. And Dr. Kelly, I'll start with you today.
Oh, just to say, I truly do appreciate all the effort and behind-the-scenes legwork that goes on in a transition like this. And I mean, I can remember many iterations of Common Core and Next Generation Standards and Sunshine State Standards and FCAT and ad infinitum, and I know the blood, sweat, and tears that goes on when you're trying to put these plans in place. So I truly do appreciate it on the work of everybody behind the scenes. So thank you for that.
Okay. Mr. Destin.
Well, I don't have anything
Okay.
further today, I don't think.
All right. Ms. Ivanchek?
Yes, first of all, I want to congratulate everyone involved in all the graduations. I thought that was great, and it left those class of 2020 students with, a final really good memory and on a high note. So thanks to everyone. I know that it was a lot to pull off by those administrative teams at each of those high schools, but it all went great, and I appreciate that. I do have a question about on Monday night. It's on our agenda to look at approving the calendar. When are we anticipating getting to see that?
We're hoping that it's going to be Friday. I think Dr. Hale is meeting with the union. I think the union survey is also going to be done today, where they've surveyed their teachers and so forth. So that should be done today. And then I know that Dr. Hale and Ms. Alperberg and others will be meeting tomorrow. So the hope is to have the calendar to you all tomorrow.
Okay, thank you. And then our last workshop a couple of weeks ago, you spent a lot of time going over the comprehensive plan that that you had, Mr. Superintendent, with your team that you've worked on a lot, and I know you've worked a lot on that to show us what your plan was. So with that, I know we're gonna vote on the calendar, but will that plan be presented in front of the board for us to vote on?
I don't know, is that necessarily a voting item because of Mr. Chambers in his position? I mean, he can present it to us, but I don't know, is that a voting?
The item there that needs to be voted on, in the original plan, the reopening date was consistent with the calendar the board had already approved, so there was not a change in a board mandated calendar. Because of the proposal to recommend a different date, the date has to be voted on because you do have an approved school calendar in place right now.
Right.
The executive order from the Department of Education didn't mandate necessarily that it was a board or superintendent plan. It just said the district turns the plan in. And so, you know, Mr. Chairman, I don't know that there's a requirement that had to be voted on, but the calendar change has to be voted on because the board had already approved the calendar.
Okay.
And I would say, and I think we've communicated all along the way, and if you all would like, I know we talked about it at the last workshop, we've talked about it more here today. If you would like to vote on it, I'm more than happy with that as well.
Okay.
Okay, thank you. I know that someone, I think it was Dr. Kelly, brought up about the masks, and I think there's some differencing opinion on how the mask goes. And that's why I was wondering. So I don't know if we want to look at parts of it or look at the big picture. That was my question.
Okay.
But we could, I'm assuming, bring that up in discussion later.
And that can be, yes.
Absolutely.
That's right, and I would suggest that as we go forward and see how
Right.
things
Right.
unfold, that would be the appropriate time to
Right.
step back
And I
make
was going to,
suggestions.
and I was going to agree with that. I think, you know, with the changing every day, if we commit to something now, then it could change again. So I think that's appropriate. Thank you, Mr. Destin.
Right, it's very, very fluid. But I do want to thank all the executive staff there, you know, your senior staff and all that work, Ms. Lightborn and everybody. I know that that has to be an extreme amount of work, and I really do appreciate all the hard work you're doing and the details bringing that to us today. Thank you.
Thank you, Ms. Ivanchek. And Dr. White.
No, Mr. Chairman, I'm good. Thank you.
All right. And my closing comments reflects back on last week, graduation week, and it was my honor to participate in 7 of those graduations. And I will tell you, my most vivid memory of all of those graduations is just to see the faces on the students, on the principals, everybody who was involved, the parents, everybody. Just an exciting time, and it wasn't normal, but it was normal. And, you know, just to see everybody out in the stands, I thought everybody, all the schools did a great job of coordinating the actual graduation ceremonies themselves. I know seeing the social distancing, you know, it was, I thought it was done very, very, very well. And, but I will tell you though, it was hot, and I'm glad we don't do graduations in July all the time. So, but I will tell you, it was an exciting time just to see the faces on everybody and have some normalcy to what's going on. And so now we'll move down to public comment. This will be the second part of public comment, if we have any, and then we also have a lot of public hearing on that night. So I'll just run down real quick. 17.1 required local effort millage rate. 17.2 basic discretionary operating millage rate. 17.3 capital outlay millage rate. 17.4 total millage levy. 17.5 resolution 20-04 adopting the tentative millage rates for the fiscal year 2020-2021. 17.6 Okaloosa County School District preliminary and tentative budget general fund for fiscal year 2020-2021. 17.7 Okaloosa County District preliminary and tentative budget special revenue funds food service for fiscal year 2020-2021. 17.8 Okaloosa County School District preliminary and tentative budget special revenue funds federal programs for fiscal year 2020-2021. 17.9 Okaloosa School District preliminary and tentative budget debt service fund for fiscal year 2020-2021. 17.10 Okaloosa County School District preliminary and tentative budget capital project funds for fiscal year 2020-2021. 17.11, Okaloosa County School District Preliminary and Tentative Budget for Fiscal Year 2020-2021. And 17.12, Resolution 20-05, adopting the Okaloosa County School District Preliminary and Tentative Budget for Fiscal Year 2020-2021. And with that, this meeting is.
Mr. Bryan?
Yes,
I have
ma'am.
something.
Yes, ma'am. Go ahead.
I just wanted to point out, I'm sorry I didn't catch it when we were up there, but it's about the millage rate.
Yes.
I just wanted to point out, when I was speaking with Ms. Scallon, I don't know if she wants to speak to this real quick, but she told me this is the lowest millage rate in 30 years.
All right. Did you want to comment? No. Rita shaking her head with a enthusiastic yes. So, all right. So.
Yeah, so I just want the public to know that when you're talking about the millage. Yes,
All right.
thank you.
All right. Thank you, Ms. Ivanchek. And with that being said, this meeting is adjourned.